if the guest is, he didn't really drink, but if the guest wants to, we'll do like champagne or mimosas. Sometimes we'll do them pretty early in the morning. So
I get a little loopy sometimes.
Yeah.
It doesn't take much for me.
I'm sure if you don't usually drink.
Do you drink?
I am trying to not drink anymore.
Really?
Mm-hmm.
Sounds like
but
you
do
have.
I drink? Yes. Typically, I am a drinker.
What's your drink of choice?
Di Serrano.
What is that?
Serrano.
Yeah.
No, that's
It's an amaretto
liqueur.
Yeah, exactly.
Just straight or what?
Yeah. Don't even put any ice on it. Nothing. Just put it in a glass for me.
It's basically
All the way.
syrup, right?
It's 100% syrup.
What are
it's
the-
like diabetes in a cup.
Yeah.
Hell yeah.
What's the calories on that?
Too many. Yeah.
Do you know?
No, I don't.
I don't either.
I've looked it up plenty of times, and then I just have a mental block for it because I don't need to know.
When you get in a position where it's like you want one, like, I'm just curious, what do you do? Like, you just forget about it?
Make a mocktail.
Make a mocktail, drink
Yeah.
that. You're not buzzed, and then you're just fine?
Yeah. It's almost like it still satisfies that part of my brain of like, I don't know, like a placebo effect, I guess.
Yeah. A lot of places are starting to do mocktails too. Like they have
Yeah.
them on the menu. There's some beers that I don't know why you do it. There's just all those calories.
I wouldn't do that.
But there's IPAs that are,
non-alcoholic.
non-alcoholic,
Mhm.
so you can still indulge.
Yeah.
I don't
White
like the way
Claws.
they taste. I want to get drunk from it or whatever.
Right.
But
White Claws, they're also doing it, but I was never a White Claw girl before. Never drank a beer in my life. I didn't drink until I was almost 21, and I think I cleaned up too many parties of hot beer, and so they all just made me like, I'm good.
Dang, so you waited till you were of age.
No, almost.
Okay.
Yeah. Almost.
20.
Yeah. Yeah. Keyword for sure. My first drink was Malibu and Coke. Delicious.
See, that's my wife's drink right there.
See? It's great.
Malibu and Coke is killer.
Yeah, Malibu. Anything with Malibu, she loves.
Yeah, it's
So
like you can drink
good.
it straight pretty
Yeah,
much. You
so
like those
good.
liqueur type
I
things.
like sweet drinks. I like diabetes in a cup.
Yeah.
Like 100%. If it doesn't spike my sugar, then why do I want it? Yeah.
Wow.
Mm-hmm.
What's hard for me is we work in a corporate environment. So when we have corporate functions, that's when it's hard for me to turn it down because everyone's doing it. I've gotten better about saying no, but then you're that guy. You're the only
100%.
person.
That's why you need something in your hand.
So we're kind of late in the podcast, but
we didn't. That's all good.
Oh, yeah.
but for the listeners, you want to kind of briefly say who you are, what you do, why you're here today?
So my name is Laken Stamps. I am a doctor of chiropractic, and I work at a gym called Alphaland in Missouri City, Texas.
And you're the
I am
chiropractor.
the doctor.
How many are
yeah.
there?
It's
you?
just me.
Yeah.
Yeah. We do plan on having multiple. Well, I don't know if that's public. Never mind.
Hey, chip.
Yeah, never mind. But eventually, we do hope to have some growth. So,
How long have you been there?
we opened in January 2 years ago, and I was there by March. So 2 years now.
How did it become what it's become? I feel
Yeah.
like everyone from around the country.
And where it's at.
It's not
Yeah,
just
isn't that
Houston.
crazy?
What's
Yeah,
going on?
it's like Houston exploded into this fitness
Mm-hmm.
monstrosity that people from around the country, around the world are coming to. Like, hey,
Yeah.
you know, Alphaland, the shirts. Everyone's wearing the shirts now.
Yeah, it's a whole
How
thing.
did it happen?
So Christian Guzman is our owner, and he's a big YouTuber. So in 2015, he started Alphalete, I believe. I could be completely wrong because I honestly did not know who Christian was, what Alphaland was, what Alphalete was. I didn't know any of it.
Is Alphalete the brand?
The
clothing brand?
line.
Okay.
Yeah. I didn't know any of it. I just knew I wanted to be in a gym, and I had done bodybuilding shows before. So I felt like I knew the sport, and I knew I wanted to work with athletes. At the time, I was working in a clinic of like everyday people, and I found myself getting so frustrated because they expected you to come in and just like, wham, bam, you're fixed. And they weren't doing anything on their own to like be better, you know? They'd come back a few days later and be like, it still hurts. And I'm like, have you been doing your rehab? You know? And no. So I knew I wanted to be around people that cared about themselves, cared about their fitness, cared about their health. And I ended up at the best place possible.
That's awesome. So when you were a bartender, were you
Mhm.
going to school for chiropractor?
No.
Or no?
I went from bartending to, my undergrad is in psychology. So I went from bartending to one of my regulars in the bar was a higher up in oil and gas. And he offered me a job. So that got me out of the bar scene, which is a hard scene to get out of because the money's really good. And I'm not going to say really easy because the hours are terrible, but it's not hard work, right? Like it's taxing, but it's enjoyable. For me, I enjoyed it. So he got me out of the bar, and then I was working in oil and gas. That's what brought me to Houston. And then from there, I ended up with a boss that we weren't friends. We just weren't friends. I had moved here, had one boss, and he and I were thick as thieves, adore him. And then we got this new guy, and the new guy and I just couldn't. He was a micromanager, and I don't respond well. And so at that point, it was like, I'm doing an engineer's job, but I don't have an engineering degree.
That happens all the time.
Yeah.
Don't get me started on
Yeah.
that.
No,
Don't get me started.
And so I was always going to be under someone else. And I had been okay with that up until that point. But then I realized that there was a chance I would always be put under somebody that I didn't get along with. And I also felt like I was sitting at a desk all day. I didn't feel like that was my calling. I felt like I was supposed to be helping humans and animals, and I wasn't. I was just sitting all day and then going to the gym at night, going home. It was clockwork, but I didn't love it. But it's hard to complain about something when you're able to pay your bills.
Making a lot of money.
They love giving you money and all. Like, they just love it, and I loved getting it, you know. And so I couldn't figure out how to go to my parents and be like, I know I'm making a killing, but I don't want to do it anymore, you know. And I remember when I told my dad. So what I did is I started shadowing different doctors. I wanted to figure out, like, I want to be a doctor. What kind of doctor do I want to be? So I shadowed all different doctors. My uncle is an orthopedic surgeon. I watched a surgery, and when you're asleep, they don't care about you anymore. You know, they just want to get the job done. So they are hammering on you. And I understand that it probably takes that pressure. For me, I wanted to pass out. I was like, not it. So then I shadowed an ER doc. I realized that dry heaving, like where you're about to throw up, but you're not, I can't do that. Can't do bodily functions. I'm out. So I left. And then I thought I wanted to be an orthodontist because my teeth before and my teeth after, if I could make somebody feel the way that braces helped my confidence, that'd be awesome. Only the top 2% from dental school can even apply for orthodontics. I can't imagine, and I hate the dentist. I can't imagine finishing dental school, not getting into orthodontic school, and then having to be a dentist the rest of my life, you know? Yeah. And so I was just like, what am I supposed to be? Shadowed a chiropractor and just thought, that's pretty neat, you know? And had I gone through this after COVID, I would probably still be in oil and gas because I was finished with my job description by 10 a.m., you know, and then I just had to sit there the rest of the day. After COVID, I would have been done at 10 a.m. and able to do whatever because nobody works at the office anymore. And so I do believe everything happens for a reason. Once I shadowed the chiropractor, I felt like it was like he was a surgeon without a scalpel. You know, you're figuring out what's really going on with the human body and fixing it from the inside. And I thought that was really neat. And so I wanted to be able to do it. I also felt like at the time, I was like, this is awesome because it keeps you active. You have to have, you know, a healthy body to be able to work on these people. Now that I'm in practice, I'm like, I'm not going to be able to do this forever. Like, this is intense. But that's neither here nor there. And so I remember when I told my dad I'd figured it out, like I'm going to go to chiropractic school. And he said, why wouldn't you want to be a real doctor? And I was like, oh man, you know, like, that hurt.
Back to the drawing board.
Yeah, exactly. But I will say once he came to Texas, I'm from Mississippi. So once he came to Texas and like came to my white coat ceremony, saw how intense the program was and this, that, and the other. Now he's on board. So he's come a long way. He knows I'm a real doctor now.
So you did all your schooling while you were at work? Like you did it online
no, I quit.
Or what? Oh, you just quit?
I left oil and gas. If anyone can go through chiropractic school or med school or any, professional program and work full time, I want to meet them. Like, good for you. Way to go. What's that brain like? I wouldn't know.
That's crazy.
Yeah.
So how did you reach out to all these doctors? I guess through your family? Like how did you?
I had some friends, family, but really like you would be surprised. So many students or people reach out all the time wanting to shadow, wanting to just kind of see how you run your practice, see what you do. It's not abnormal to just get an email that's like, hey, can I come hang out with you for the day? So it was out of my comfort zone to send them, but it was also something that I was like, I needed to do it.
You know what I really want to talk about is what the hell engineers do.
Jeez.
Are you an engineer?
No.
I am now.
You are?
He is
okay.
now.
But I had to go back to school to get the engineering degree. So we work at a big chemical company.
Okay.
That has 3 letters and a red diamond.
Okay.
And so I went back to school. I did my formal education or whatever was criminal justice.
Oh.
And then that doesn't do anything for you. And
neither does psychology. You have to go back. Yeah. But I do feel like my psychology background I use
socially.
But with my patients, because I feel like the body holds on to emotions and holds on to stress within the body. And so I have a lot of patients that it's like whenever they start telling me about their injury or their pain, it shifts to what's actually going on with you, and it's proven that the body holds on to stress and like our body, our emotions, our thoughts, it's proven that it's there. And so it's a matter of figuring out what's actually going on as to how to release it. It's pretty neat. It's like, here's an example.
There we go.
I went and got a deep tissue massage yesterday, and the girl was like, hey, do you train pecs a lot? And I was like, not an abnormal amount, and she said, your pecs are just super tight. I had been in therapy, and my therapist was asking me a question, and she said, where do you feel this the most? And I said, in my chest. And it's like, wait a minute,
Whoa.
It's crazy, but everything is truly connected, in my opinion. So, yeah.
You got to work through that mentally to start getting that stress away from those areas, because you can work it out with a deep tissue massage, but then it's going to come right back. Yeah.
It'll come back. Yeah. I had a patient reach out yesterday because I think a lot of times people think with chiropractic care, they're like, oh, it doesn't work. I went once and, my pain came back, and it's like, I wish I could eat a salad once and have like the sickest abs,
That's good.
That would be incredible. That's just not how the body works, And so I had a patient, he came in, he threw his back out, and he's a gymnast. And so, he's constantly tumbling, constantly lifting, and he left feeling like a new man. He came up to me a few days later, and I told him before he left, you might leave feeling good, but be prepared. It'll probably come back. Well, I had seen him like a week later, and not in an appointment. And he was like, I feel awesome. I'm like, I love that. Please be careful. And he texted me yesterday, and he's like, hey, I threw my back out. And I'm like, no, it was never back in. You know what I mean? Like, it was never, you were feeling better, but it takes more than once for it to actually heal, So, yeah, there's that.
So how do you, what do you tell your patients when you're working? If they have something, you can tell that they're working through something emotionally or something traumatic's going on in their lives. What advice do you give them?
So I always encourage them to tune into that. Like, I have a very close friend who carries stress and has a very stressful job. And I encourage you to go get some body work done. See how you feel after. Never had a history of getting body work done. I think a lot of times people feel like the two aren't connected, you know? And so it's just a matter of encouraging, like, just, you've got a lot of tension. Why don't you go get some body work done and see how you feel after? And then in time, it's like, hey, are you feeling a little better? Are you feeling a little better? And I think it happens without even paying attention to it necessarily. But then whenever they start making those connections, it's like, dang, everything really is connected. How about that? You know?
Wow.
So it's just encouraging them. I think this would really help you. I think this would be really good for you. Because I don't want to sound like that person that's like, I can fix you, you know? But at the same time, other people can fix you too. But you have to be willing to put in the work, get the work done. So, yeah.
Tell me about the first time you worked on somebody. When you first got out of everything.
Yeah. Yeah. I can still see her face, bless her heart.
Yeah. Rest in peace.
I hope she's doing all right. So I was working at a clinic, and I had started, and at this point, I don't, you know, in school you work on all sorts of people, and they have a clinic on campus, and you have a lot of people coming in, and that's one thing, but you're still under the care of a doctor above you. So it's like, help. And, you know, and so you can call him back up. This was my first patient on my own. And I thought that I was only there that day to like learn the computer system, watch, not touch. And one of the other docs was like, hey, why don't you take this next one? And I was like, take them where? You know, where are we going? Yeah. And he was like, you got this. And I didn't want to do it, not even a little bit. And because I'm the type person that I am rather shy until I'm confident. You know what I mean? And so I was not confident. And here comes this sweet little blonde. And I didn't tell her that it was, you know, my first patient, but I'm pretty sure she could tell because my hands were sweaty. But I mean, overall it went well, but she never came back to me. Hope she's doing all right. But yeah.
What did you hurt her or something?
No, I didn't hurt her. I think my adjustments were way too soft at the time. And so we didn't get a ton of movement. And for a chiropractor in chiropractic school, they tell you like, hey, it's not about the pops, you know, it's about the joint movement, and you're getting that movement even if you don't get the pops. You can tell that to your patients all day long. I don't not believe it, but I can tell you the patient wants the pops. You know what I mean? And so I tried giving her that spill of like, we got some good movement, but not a lot of pops today. But next time maybe we will. And I could tell she was just kind of like, have a blessed day, you know? Like,
bless your heart.
Exactly.
What are the pops?
It's air being released from the joint. Yeah.
From internally in the joint? It
like
releases
gases.
Externally?
Mm-hmm.
Really?
Well, not externally, but still.
Can you debunk some stuff for me?
Maybe.
Uh-oh.
Popping fingers, is that bad for you? Is that going to give you arthritis?
That's the number. Science has shown that it doesn't.
Okay, so I'm
So-
good.
So science says it.
Science says
I believe science.
Yeah. There are studies that argue for it and against it, but the last one that I read was like there was a guy that popped his knuckles, I want to say for like, I don't remember how long, I don't want to be wrong, but basically he did x-rays after and there was no difference in his hands. So like he popped the knuckles on one and not on the other.
That's good.
And so now it could be that it wasn't, the effects don't set in until later on. That's possible.
Yeah.
But based off of his study, pop those knuckles.
Okay.
Yeah.
Pop the shit out of them.
Do not be cracking your neck though.
Okay. I'm glad you brought that up. What is that about? I've heard people, have horror stories that their friends of friends have been killed popping the neck.
So
Is that a real thing?
not if they're going to a good chiropractor. I mean, it's more so if I'm telling people don't crack your own neck
Okay.
because you don't have a clue what you're doing. And all of your nerves stem from your neck. And so whenever you start messing with your neck, you're more than likely just grabbing your chin, pushing on your head, you know, pushing or pulling, whichever direction you want to go. And you're moving the same segments every single time, as opposed to when you go to a professional, they should be figuring out which segments aren't moving and moving those segments, as opposed to just like full send, you know?
So scary.
It can end up getting a disc loose, basically herniating a disc and causing some damage.
Are you offended if someone doesn't want you to touch their neck?
No.
No?
I don't get very offended.
Is it because I know some chiropractors get offended by that.
Well,
I've
they
heard.
need to chill out then. I don't know.
Wait, you don't trust me?
Yeah, well,
Right.
I think that's what it is. Yeah, I think some.
Well, I don't want my neck touched, even if you're professional. Like, I get worried about it. Like, I don't want. So, I mean, I think that'd be normal.
Touch me anywhere else but the neck. That's
I don't want to be like 1, 2. That's
so
That's
scary.
scary.
I don't know
So
why.
we're not doing adjustments today? No, I'm just kidding.
No,
I
that's
think
I kind of want that little, you know, that.
the Y strap pull.
Yeah, and then you pull the neck up. But
That's
it looks
crazy that you
scary.
would rather do that.
It
than
just
What is
looks like
having-
that would feel good, but the turning one doesn't look like.
What
it
is
feels
this strap pull thing?
good.
It's a distraction. So it's basically considered like a decompression. You have some people that'll wrap a towel around your neck and just yank you. And then there's a contraption that's called the Y strap, where it's basically like a little cradle, and it comes underneath your neck and then underneath the base of your skull. You can do, some of them will have it where it's on both, and then some of them just have it on the base of the skull. Anywho, it comes around, and then you lean back and just
Pull it?
pull it.
Oh.
Yeah, like pulls your
my
like,
gosh.
skull off your spine, but it pops really good. It looks like it would just
goes
give so much
all
relief.
the way down. I mean, you'll feel it.
Do you do that?
Mm-hmm.
Yeah.
So it separates like all the vertebrae almost.
Yeah.
Dang.
Yeah, that one looks like you would like, once it's done, you're like, oh. You know?
I'm gonna need a minute. I'm
Yeah,
gonna need
yeah,
a
yeah.
minute. Yeah.
I like the best, obviously, the ones where you
The
go
side
here.
posture.
Yeah, I do that
Mhm.
myself. Like, I'll just like pop over but like why is there air generating in your joints? Like, is that a good thing?
It's not a bad thing.
Is it a normal thing?
It's a lot of movement, right? So we're constantly moving as beings. So it makes sense that there would be air trapped under the joint. I always think of like, when you were a kid, did you ever blow bubbles under the ladder of the swimming pool?
Oh, yeah.
Yeah, it's the same idea.
Blow
And then
bubbles?
you can, yeah.
That's very specific.
Well, I try to think of analogies that people can relate to.
You ever swim in a pool or
Like
what?
bubble it, like on the
Yeah.
surface? Okay.
But not on the
I thought
surface.
I immediately went to like the bubbles, like blowing them out of like a.
Oh, yeah.
Yeah.
No, I mean like.
That'd be cool
just
too, though,
regular-
right?
That would be cool, yeah. Especially if you could do it underwater.
I do remember being behind the ladder like for
Yeah.
hours, like just like popping in and out, going under. So
Yeah.
I feel you on that.
What else you got?
The air. Let's go back to the air.
Okay.
So when I was young, I couldn't pop my fingers,
Okay.
but now I can pop the shit out. Like all of them pop. I don't even want them to pop, and they pop.
Mm-hmm.
Do you think over? You go. You think over time, just like things are easier to pop when you pop them, and is that a
Well,
good thing?
your bones are also more calcified, right? So whenever
You
you're
call me old?
no, never.
Never.
Whenever you're growing, like we still have joint plates that aren't, or growth plates that aren't completely closed, right? And so it could be just that you were trying before your time was right, and now look at you go.
Now I'm just popping
Now
away.
you're just
Popping the
popping all
shit
over
out
the
of
place. Yeah.
Oh my gosh.
There's a lot of, in my mind, since I don't know
A lot
a
of
lot. There's a lot of what?
A lot.
Yeah, we're trying to say that. To me, we're trying to stop saying certain words. And
Oh,
sometimes
what are the words we're not
A lot.
saying?
a lot, like a lot of people.
Oh,
Ah,
If
I
you're
don't-
gonna
so
if you're
aggravated.
gonna tell me something, a story, or you're like tired of something going on and you want to like state it, how would you start? What would be the words that you'd start with?
ask me the question again.
Like say like
Even like,
well, like of course, but say you're tired of someone doing something all the time and you want to exclaim it to someone else, and how would you start the sentence?
I don't even know.
how do you just like tell me a story about the gym when you walked in? Like,
I don't think we're gonna get it out of it.
Yeah.
So do you ever say it's crazy that?
Oh.
I don't think so.
No,
No, there's no way.
I don't think so.
she's smart, dude. You're not an idiot.
Maybe you're a little smarter than us.
She's not an idiot. Dude.
So we say it's crazy that, or
you say that. I don't say that. I say, isn't it weird?
It's weird. It's weird that. It's funny that.
It's funny that. I say that. You don't say that?
I'm sure I probably have said it before.
Now we're going to make you conscious of it.
I know. Now I'm going to be like, it's funny that.
It's crazy that.
Yeah.
There's all those, but another one is a lot of people, a lot of this, a lot of that. I even noticed it with guests. So it's like, you don't know a lot of people that are doing this. It's just like a good segue into that to talk about something so you can get people to believe. You're just throwing
a bunch of people in this group that don't even
under
know.
the bus sometimes.
Whenever we're editing the podcast, we notice stuff that we say all the time. Yeah. We started editing our stuff with AI tools.
Oh, nice.
So instead of manually editing,
don't
like
give all our secrets.
Well, everyone's doing it. It's not a secret. So like right now we have 2 cameras and then we have the audio, right?
Right.
So we would, before AI, we had to drag in each clip and then the audio and then go back and forth. So when you're talking, camera's on you. One of us talks, goes back to us, the whole podcast. So we do a whole podcast, put the podcast in the computer, then edit it. So so if we talk for an hour, it takes about an hour and a half per podcast. Wow. So now we have AI, though. It does it for you. You just drag it in, you press start, and it edits the podcast for you. And it goes through and makes all these little cuts really fast.
Less than a minute.
Less than a minute for an hour and a half podcast.
We got to
That's
the point.
Insane.
We got to the point because, if you're editing an hour worth, it's at least going to be an hour because you have to basically watch it to do it. And it's disturbing because I hate our podcast. But we had a trick to fast forward it like times 2. So but we know at what point we're going to talk, so we can cut. That was even more annoying, but we got it done in like
30
40 minutes.
Yeah, 40 minutes, like an hour podcast.
You're saving a little bit, but it was like
it's not enough. So then, like our podcast clips, there's this thing called Opus. There's a bunch of them, but we use Opus right now. So we take the finished video clip, we throw it into Opus, which is an online AI tool as well. And then based on what's trending around in the world, like let's say what's trending right now, Texas blocking Pornhub. Okay.
Oh yeah, I heard
that's a big thing, right?
Yeah,
which really pisses me off. We can get into it, but
Pornhub?
Yeah.
Oh no.
Well, just porn sites in general.
Oh, okay, good.
But if that's trending right now, so Opus would recognize what we're talking about and provide us Instagram reels for our Instagram for whatever trending.
Crazy.
So it gives you, we throw in
grade them.
Yeah,
now I'm saying that's crazy. Shoot. Okay. Yeah. It's crazy how.
Yes. You're just like us.
Oh, that's wild.
That's wild.
It's wild to see.
Yeah.
Oh my gosh.
Yeah. Man.
I don't know
AI is taking over.
Yeah, but if you have an editor, your editor's probably using it too. I just gave him all his tricks.
Probably.
Or her tricks.
Yeah.
They're kind of terrible still. I do that part of it. And it gives you like 12 samples and it'll grade them all and it'll summarize like why they think it's good or this or that. But you can go in and you can add, like if they kind of didn't start at the right moment, didn't really get the point across, you have to go in. Yeah. You can.
AI is an idiot. We do it.
Yeah, I'd give them shit all the time.
Yeah.
Did you see?
Be better.
Elon Musk said that AI next year is going to be smarter than the smartest human ever.
I believe it and I don't like it.
Do you use any AI tools?
No.
No?
I don't. I had a meeting with part of our marketing team earlier this week and she encouraged me to try it and I was like,
which tool?
ChatGPT.
It'll change your life.
You at least need to do that.
It'll change your life.
That's the tried and true.
It's cheating.
It is cheating, but how much time do you want to waste on an email?
Yeah.
It's your time, really,
it's
what AI is helping with.
You got to watch out for the buzzwords that ChatGPT likes to use.
It's disgusting.
Okay. It sounds like a Disney, like if you were to read a Disney story, because you put in an email. I don't know if you send a lot of emails, but if you put in your email, if you put in, you can take your email, put it in a ChatGPT and say, rewrite this for me to make it sound more friendly. Wow. And it'll use words like embark. Or what's another one? Give me another one.
Oh my gosh.
Embark or exposed. What's another one?
Just like
journey. Like come on this journey with us.
Didn't you call them fantasy words?
They're fantasy words. Yeah, fantasy words.
And but like you dump it in and you don't have to say, hey, with what you just wrote, do this. You just put less words, more words. more intelligent, more corporate, whatever, and it just keeps fucking
It just
changing
knows.
it.
You can adjust
Sometimes
it.
There's a word I don't like, and I said, use
Yep.
something else besides this,
Yeah.
and it'll change it. So, man, and I thought it was kind of shitty, like, you know, like people would go around the system and not work, but it's like, man, I really don't want to spend my time
Yeah.
doing that. And sometimes for even like,
Can you imagine how easy school would be for kids?
I
using
finished my senior year of engineering school with
that in no
ChatGPT.
time.
you know,
And ChatGPT. Because I'm working full time,
Yeah.
family, working, ChatGPT, put it in. It helped me write my entire paper.
Thesis? Or,
Yeah.
yeah.
Whatever it was
I-
called.
Whatever
Senior
you were
project,
doing.
Senior
Yeah.
I
project,
don't even know
whatever.
what the fucking name
I don't even know what I
Drop
did. I don't even know what I did.
I blacked out. They did it. I
Yeah,
did.
yeah. I haven't used it for relationships, but like you can put in there like a fun first thing to do is put like apologize to my wife Rebecca for going out late and drinking with the boys too long. It'll spit out a book's worth of information. You can write a book on there if you wanted to. Just say, hey, I want to make a fucking book about wizards.
If Rebecca knows you at all and you send this Chat GPT apologies, it's going to be like,
You just put make it stupider. And just
Yeah.
keep doing
Make it sound
no,
more
she
human.
won't believe it. Nope, try
Yeah,
again.
yeah, yeah.
Make it sound more human. But you can add plugins too. So trying to think how you would use it for. You post a lot of like videos showing you doing stuff. So for creators that like create PowerPoint slides or whatever, or like, you know, art slides, you can plug in Canva into ChatGPT and say, make me a presentation on my small business for this, blah, blah, blah. And it'll make it for you. It'll connect PowerPoint, whatever tool you want to use, and it'll create it, the post for you. It's pretty intense.
That is intense. This world is scary.
How old are you? Do you mind me asking?
I don't mind. I'm 36.
Okay, so did you, like, I'm 35.
All
We're all
right.
about the same age. Did you ever think that we would get to where we are now in our lifetime?
Which part?
Just
With the AI?
AI technology.
Well,
Watching
based off the
Terminator.
Jetsons, yeah.
Yeah.
We're not there yet, though. It's in a different way. You remember phones, whenever we were in high school, they were
Yeah.
like terrible. You were playing that worm game where it's like you
Snake,
just try to,
heck yeah.
That was a
you try to
fun
go
one.
get
That
the
was a
dot,
good
and you're
one.
like, oh shit.
I
you
got
know,
it. Look how
exhilarating.
Yeah.
Yeah, like, and now these motherfuckers are playing Grand Theft Auto on their phone.
Yeah.
Like,
Monopoly. It's
Monopoly, that's the one you pick.
That's the one you
That's my
play.
age. Yeah.
That's the one you play.
You probably play Bejeweled. There's no way.
I never heard of it.
With the jewels and you match them?
No.
Well, you're in for a treat.
Is that
I know what
you
I'm
play?
doing tonight.
Is that what you... She's drinking. She's just drunk playing.
Yeah.
That's wild.
Where did you get your rubber ducky? You just carried this
We
around?
somehow had it in here one day, and now I'm obsessed with it. So
yeah.
it stays in here.
It's like
if it
your
ever
little
leaves.
fidget spinner.
It's a fidget spinner.
Yeah.
We went with a buddy on his 40th birthday to Mexico, and we numbered 40 ducks. He loves ducks.
Okay.
He drives a Jeep. So we hit them all around the resort, and for every one he didn't find at the end of the
had to
trip,
take a shot.
he had to take a shot.
See, there's so many fun drinking games.
So this was number 4. He had to drink a shot for this one.
So how many did he not find?
Oh, so many.
He's dead.
Aw. Yeah.
He drank too
He would
much.
get them and put them
He's
in
up
his
there
little.
with my first patient.
Oh,
That's good.
Just kidding.
I love that. I love that for you. But he would put them in his little pockets, and then when he got too drunk, we'd just take them back. So he didn't end up with too many at the
Yeah,
end.
poor guy.
And they squeaked at first, but we started taking the squeakers out because people
Yeah.
were getting fucking annoying.
Yeah.
So, but we would have it in our pockets and we'd
Just
squeak them,
squeak,
and he's like,
Oh,
like, where are they at?
it's like it's close. It's
Yeah, yeah.
close. I can feel it.
Some people were putting it in their mouth, a little squeaker, and they're
Yeah.
like,
Boys.
however that sounds. Yeah, boys will be boys.
Boys will be boys for sure.
Back to chiropractic.
Yeah.
Is that the right
Yep.
conjugation?
Said it good.
Yeah.
Conjugation.
I said
Look
that
at you,
before.
dude.
Yeah.
Well, we better end now. So for me, thinking about it, it's like something you'll just always have to do.
Have
Like,
you ever been to a chiropractor?
oh, that's a good point. That's a good question. All right. Aside from that,
She got you. Yeah. Let me move my chair over here.
Yeah.
let's
There
think
we go.
about theory here, 'cause I don't have the practice. But it's like you get adjusted, and then you're going to do whatever you did before, and your gait or whatever the hell is just going to form back to what you had. It, aside from injury, say you're just
Sure.
healthy.
It's wellness.
Yeah, your wellness check or whatever. So you're going to do the adjustment. It's going to go back to normal. Then you're going to come back. are you going to make any long-term gains like over time? Like what could you expect if you just keep going?
So scientifically, it is shown that at first, the longest your body will hold on to the adjustment is 3 days. I always use the comparison of a healthy diet when it comes to body work, because if I eat really clean for a bit and I get nice and shredded, and then I'm like, I did it, and then I just start eating whatever I want, my body's not going to stay nice and shredded, right? So the same is true when it comes to your adjustment. It'll hold for about 3 days at first, and then it'll start to set back in. But it's also training the body to hold on to the adjustment. So after a few adjustments, your body's like, oh, this is where we're supposed to be. My bad, right? And so it starts holding it a little bit more and a little bit longer each time. Now, because we are constantly moving, then I always tell people, I believe the longest your body's going to hold on to an adjustment is about a month. And you're going to want to go monthly. But it takes a bit to build to where you can get to monthly. There are people who say that you need to go 4 times a week at first. And it's like, in my belief, chill out. You know, I think a lot of it is for sales. And I'm openly not a good salesperson. I
can tell.
Yeah, I'm not at all.
Don't come to me. Once a year is good.
Yeah, you know, I want my people to feel good. And I'm a believer in them. And I also treat animals. And so the coolest thing when people come to me with like doubting chiropractic care, I've had 3 dogs that could not use their back limbs walk again. So wrong, you know, like
Wow.
It's so cool because humans will tell you like, oh, I feel better. And it's like, I hope that's true. But with a dog going from being unable to use its hind limbs to walking again is enough proof for me, you know? What was your question?
Mike was trying to call you out, I think.
Yeah.
Yeah, you like the long-term benefits of.
Yeah.
You said so I guess what I got out of that is you start off with holding your adjustment
Mm-hmm.
for 3 days, and you can get up to about a month, and then but you're gonna need to go at least monthly.
So I always think of this too. You can brush your own teeth, right?
I love these things.
Yeah. You can brush your own teeth.
I never have,
but you know, it's an idea.
This theory.
Yeah. It's crazy.
It's crazy.
It's crazy that.
But you can brush your own teeth, but if you go to a dentist and get a dental cleaning, it's going to be a much better brushing, right? So you don't have to keep going after you get your teeth cleaned by the dentist, but it's encouraged. The same is true with the adjustment. It's not something that, like, if you were to just stop going, you're going to be like, I'm a different man now, you know, but your body does move better if you are consistent with it. So I always tell people, like, so many fields are quick to come for chiro care, but I always encourage them to think about, tell me another profession who, as a doctor, lays their hands on their patients without medicating them first, without any, there isn't one, you know, like these patients that are coming to us are of a sober mind. They are coming to you already in pain or wanting a wellness treatment. And so it's a matter of understanding that our treatment is hands-on and it isn't always the most comfortable, but it is healing at the same time. So it's just a difference of how we treat, I think, that makes us a target.
What is the overlap between chiropractor and a massage? There's a lot of overlap there. Like, if someone like me or just a general person who's probably doesn't have any injuries but wants the wellness benefit, who do they go to?
Both
Both of them.
Yeah. I don't see that to me, a massage therapist, I'm a believer. I had one yesterday, but that's a 6-month certification. The education is not there. And so I believe that they can do some more educating. And, you know, I'm not saying that there aren't some out there that are absolutely intelligent, but it's a 6-month certification, whereas your chiropractor goes to a doctorate program for over 3 years, you know, after having their undergrad. So it is the same amount of education as an MD minus the residency. Your massage therapist should be a full body experience. They should not be trying to treat an injury. That is not what they go to school to do, you know? And so there has become a lot of overlap because their ability in their scope is pretty broad. It shouldn't be.
Well, there's like sports massage therapists. Is that kind of
that is
the
no
overlap?
difference?
Okay.
They are only claiming they are sports massage therapists, and they are using more pressure and trying to work on athletes. So, like for me, not even just me, chiropractors in general, you may see some that claim that they're sports chiro. If they do not have extra letters behind their name saying that they are a certified chiropractic sports physician, you're just a chiropractor claiming that you want to be in sports. Good for you, you know, but you haven't chosen that education for it. Does that make sense?
No, it makes perfect.
You kind of sounded like the oil and gas engineer.
Yeah, it's in there.
Yeah, they're basically doing the chiropractic job,
Literally.
you know, just on the certifications.
Yeah. And there are massage therapists that will try to adjust, and that's crazy.
Wow.
Thai massages do some of that, right? Like they're
They
pulling
do
your
all
leg
sorts
over.
of stuff.
they're-
Yeah.
Man.
Won't see me there.
No?
No.
You could coach
absolutely
them.
not.
Coach up or coach
Coach up.
down.
Yeah.
Coach down?
Coach. I'm not coaching, period. So.
We
You
went
might
to
want to try this.
I went to this one massage place. I forget what it was called in Pearland because Mike goes to massages pretty regularly.
Mm-hmm.
And me
I've
and
never been to a chiropractor.
I've been to a
There we
chiropractor,
go.
but I want to go to you.
There you go. Come on.
She's too busy.
I'm
No.
not. I can pencil you in.
I need some work.
But it was my first Thai experience, I guess, and they went
Ham.
a little overboard. I got grazed a little bit.
Yeah. Yeah.
Is that normal?
I don't know Thai massage. Don't ask me.
Did they teach you that in school?
They don't.
No.
What
To-
is the question?
To graze
graze?
every once in a while?
No, mm-mm.
No?
It's frowned upon. Yeah.
Okay.
It's frowned
Keeps
upon.
them coming back, doesn't
No, I haven't been back yet.
it? I'm scheduled for
Yeah.
next
He's
week.
like,
What's
I've got an
up?
appointment, but
Yeah.
That's funny.
So what was your point?
What do you mean?
But you just wanted to
wanted to know the difference in.
Oh yeah, because
Massage and
I feel like as a person who doesn't know either one in depth at all,
Mhm.
it seems like there's overlap. But you explained it pretty well that there's not.
There shouldn't be. There are some gray areas. My goal is to grow to a point that I can bring a massage therapist in under me, because I do very specific muscle work. So there are some chiropractors that you walk in, they're just going to adjust you and send you on your merry little way. I believe in more of a holistic, like whole body approach. So everyone that comes to me, unless they sign up for just an adjustment, we're going to do some muscle work. We're going to try to relax the body before the adjustment, because if the muscles are tight around that area, the adjustment's not comfortable. If you have an uncomfortable adjustment, you'll never forget it. You know what I mean? Whereas if you have a comfortable adjustment, I feel like the same is true. You'll never forget it, and it makes you want to go back. And so I do very specific body work towards that area that might be bothering you the most, whereas the massage therapist should be doing like a full body release.
It sounds like you spend a lot of time with each client. Are you worried about getting? I imagine you're already big at Alphaland. How much time do you get with each person?
30 minutes.
30 minutes?
Mhm.
Is that a lot of time? Is that enough time? Or
It's enough. Sometimes I go over if I don't have somebody lined up next and I feel like they need it. But 30 minutes is enough time for me to do my dry needling, my cupping, scraping,
Oh, wow.
anything.
You do the
Talk about
whole
all
thing,
that.
yeah.
I do all
So
of
what?
it.
What all do you do?
So I do dry needling, I do cupping, scraping, KT tape, deep tissue work.
So
you
you
name
do
it.
massage. You do
I
some
don't do massage.
deep tissue
Deep
work. Is
tissue
what?
work. Yeah.
Is that
So
pushing the
it's-
muscles, or-
Yeah.
so
It's a lot of like trigger point release
Oh, okay.
or active release techniques, things along those lines. I don't claim to do massage because when I think massage, I think full body. And if you were to come to me and say like, hey, I'm here for a massage. No, you're not. You know what I mean?
Yeah.
Like my patients when I go get a massage, I'm down to my underwear, right? Whereas if you come to me in your underwear, I'm like, what are you doing? You know, so it's definitely different. Definitely different.
Man, that's the extremes of that.
Yeah, but it's true. There's
Yeah.
differences for sure.
But you are like massaging, like like your calf hurts.
I'm gonna work on
massage
it.
a little
Yeah,
bit.
yeah.
With your hands, or do you use tools?
I'm more. I feel like I can have a more therapeutic release with my hands than tools. Dry needling is going to be my most effective because it's direct penetration into that muscle. Cupping is, surface. Scraping is also surface. But I feel like with a deeper approach with your hands, you can get into there a little bit more. So I prefer to use my hands, but I find that a lot of patients prefer tools. Like, I think that they think it's cooler. You know what I mean?
Oh,
Like,
yeah.
I think you're right.
People love the cupping marks. And so they're like, how do I sign up for cupping? And I'm like, why do you think you need cupping? Like, talk to me.
It looks cool.
It
though.
looks cool.
Because everyone's posting it on their stories on Instagram. I
Yeah.
just got
Just
done
got some
cupping.
cupping done.
Yeah,
just got cupping.
cupping.
It looks so good. And then people will wear more revealing shirts
To show their
to
cupping
show their
marks.
cuppings.
Mhm.
Yeah.
And then the
Yeah.
people in the back, they must have got cupping.
Yeah.
Yeah. I wonder where they got cupped.
What does cupping do?
So, cupping is a suction. So it's a horrible comparison, but it's essentially like a hickey. It's literally like you put a cup on and it suctions to the skin, and it pulls blood to the area to promote healing. So the cool thing about cupping is that I can put 2 cups side by side on the exact same muscle, and one cup could get darker than the other, letting you know that like this part of the muscle is more inflamed than the other part. And yeah, so a lot of times it's really neat because people will come in and say like, I have low back pain. It's worse on the right than the left, whatever. And I'm like, okay. And we throw cups on it and it appears to be accurate. It's like those cups will get darker than the other ones. And I'm like, how about that? Some cultures believe that cupping can pull sickness out of the system as well.
Wow.
For me, that's a bit of a stretch, but I'm not here to say it's not happening. I'm just here to say, good for you for thinking.
I love that.
Maybe.
I love that you mentioned that you take each client. You call them clients? Patients as a
doctor.
you take the personal like a holistic approach.
Yeah.
So when you're talking to them about their stresses and their mental battles, struggles that they're, do you talk about diet at all with them?
So we have a registered dietitian who works with a lot of our members. And if I feel like diet is playing a role, I will encourage them to reach out to her. We have a pretty good relationship. And so I will mention diet and then try to direct them her direction, because I don't want to step on anybody's toes. I don't want anybody stepping on mine, so I try not to step on theirs.
Would they pop?
They might. Well played.
Well
played.
I bet you never heard that before. Huh? Loser.
You should, when they show up, you're like, what's popping?
Yeah.
I think you need to try to figure out a way when you do the cupping to brand the middle. Like as they do it, they'll have the little marks, but they'll have
like just make a
Chiropractic.
mine, like a little tattoo.
Well, then you know where you got it.
That's true.
And they would want it.
Maybe
Like,
put a hashtag
How would
on
you?
it.
How would you do that?
I don't know.
You wouldn't
I
do
can't
it.
think of
I
Hey,
want to do it.
now
She's
with
shutting it down.
Now with that attitude.
That's
Yeah, calm
so
down.
true. So
Your dad
true.
wouldn't be proud about
He
that.
wouldn't.
If
He'd
you
be
just
like,
gave up like
why
that.
weren't you a real doctor?
Oh no! So last question about the diet. When do you notice that something, like what triggers you to say, "Hey, go talk to the dietitian"? Because I think diet is playing a role into this.
Well, if they present overweight, that's usually a good indicator. But see, a lot of our members are already working with a coach, because so many of our members are bodybuilders, and so they are already mindful of what they're eating. And so a lot of times it's a very fine line between, I don't want to sound like I'm disrespecting your coach, but what is their background? Because another field that has taken off is online coaching. And to be an online coach, you do not even need a personal training certification. You don't need anything. You just claim you're an online coach and apply for one-on-one coaching with me, and all of a sudden people do it, you know?
So do you have to be a member at Alphaland to go see you?
No.
Okay.
No, and that's another thing that I haven't quite figured out how to advertise that, you know, like, but no, you don't. You just tell them up front. They have you sign waivers, and then you just tell them up front that you're there for your chiropractic visit, and they'll either say, you know, do you know where you're going? And most of the time people don't. Yeah, and they'll send you on back.
Yeah, right by the last machine, huh?
Right there. Yeah.
That is sensitive, right? You don't want to say you don't even have to be a member to come see me.
Exactly. Yeah, because I'm very appreciative of the spot that I'm in. And so I would never want to do anything to like jeopardize our relationship. And so I had one patient one time when he walked in with the gym bag and I knew he wasn't a member, I was already like, but I'm not very confrontational at all. And so when he left, I was like, I think he's going to stick around and try to work out, you know, without a day pass. Oh. And so he did. And I just kind of let it happen and notified gym staff, hey, this guy's supposed to come back tomorrow for another treatment. When he comes back tomorrow, talk to him then, get your money from your day pass. But I'm pretty sure he didn't have a day pass. So they looked it up. He didn't have a day pass. And so it worked out well. They were able to get their money. But at the same time, it's like, it was really disrespectful. He knew what he was doing. He had messaged me before asking if he had to have a day pass to get treated. And so, you know, it's such a privilege that you don't. And so I would never want to do anything to have that privilege taken away from me. And so I watch it like a hawk, you know. Yeah. You're not gonna pull that.
Well, that
over.
builds trust with them too, that you did that.
Yeah.
But she's also a snitch.
I'm a snitch. 100%.
You'd rather to get them stitches in there.
Exactly.
I bet your bartending experience really helps you out with people. Well, with people, with the environment that you're in over there.
Yeah. My dad used to say like I wasn't using my psychology degree when I was bartending, and I'm like, every day I am.
Yeah.
You know? Yeah. But yeah, it does help a little bit.
I feel like I tell my daughters, I have a 14-year-old, well, a 15-year-old and a 12-year-old.
Nice.
And I tell them that I think they should both work they should both work in the restaurant.
Oh,
like
absolutely.
In high school, because it teaches you something
so much. But also, I wish I had done sales, because I worked in the bars, worked in restaurants, loved it. I knew when I was young, I thought about like, what do I want to be with my first job? I knew I wanted to be a lifeguard, so I did it. Then when I was a lifeguard, I knew I wanted to become a bartender, so I did it. And so I never dealt with people shutting a door in my face, saying no. You know, like I never had somebody come in and get my hopes up about buying a car or something along those lines, and then being like, and having to process that. So now when it comes to my patients, I don't push or, you know, I don't know sales 100%. If they're like, no, I'm good, I'm like, have a good day. Like, I don't, which I also feel like, and I know it's in every field, but I don't want to be known as somebody that's pushy or that, you know, is selling false information. I want people that build rapport with me and know that like she's there if I need her and she will make me feel better, but she doesn't try to like make me come in, you know?
No, I see what you're saying. I think that's very important. Your customers, your clients, your patients are going to be your sales people for you. You know, I think it's hard to touch on every job aspect before you get to the job that you're in today, but those service industry jobs are so key. Mm-hmm. And you can tell if someone has worked in a restaurant, has been a cashier. Yeah. So you can tell. We work with people that have never done anything
and they don't have good people skills.
Besides being an engineer. Yeah. You know what I mean? we know those people, and you can just tell. You can read
you can
people.
pick them out.
Yeah.
That's true.
I don't.
Damn, you're getting riled up.
Yeah, pissing me off. But
he's thinking of somebody y'all work with specifically, right?
I'm thinking
now.
about Mike.
It's me.
No, you worked in a restaurant.
Yeah, I did all that stuff.
Yeah.
You can always tell when someone comes to your table and is like, "My pleasure," you know where they worked last.
Yeah.
Like, you son of a
You
bitch.
better bring me some nuggets.
Yeah. Where the nugs at?
That's so funny.
Yeah, it happens a lot.
But it's funny how all your history is
comes together.
Damn it, it's not funny.
It's funny.
Very
It's
hilarious.
crazy.
no, it's very.
You're just gonna pick another word, and it's gonna be the next one.
I love how your history has all combined into what you're doing now.
That's interesting.
Yeah.
How's that?
That's getting close. I feel like is getting the new one. I'm just getting pissed off. I'm trying to talk to the duck. Before we get off topic of like all the things you do, this needling is like acupuncture?
Yeah.
So why does it have a different name?
Acupuncture is a Chinese medicine. Dry needling is, I don't want to say the American version because it is different. Dry needling focuses on moving chi through the body. No, acupuncture. Did I say that wrong?
You said, it's the opposite.
Okay. Acupuncture focuses on moving chi through the body. It is very much like this point is your large intestine 4, for example, and your large intestine is nowhere near here, right? Whereas dry needling is, I'm having pain in my forearm. So the origin of this muscle starts here, it inserts here. We're going to dry needle along that line. Does that make sense?
Yeah.
So it's a different approach, same needles.
And you got formal training to do that?
It's a 100-hour course.
Damn.
Jeez. So, like, what kind of things will people come in that need dry needling?
So, depending on who you go to is how I like to use dry needling as a last approach because I feel like it is honestly the most effective, but it is also aggressive, right? And it's more expensive. And so I like to start with a deep tissue release. If that doesn't get it, we'll try it, different modalities. If nothing is working, then let's try some dry needling and see if we can loosen it up. But to me, it's like dry needling it's really cool because you connect stem to it and you'll see like the muscles jumping and things of that nature. I bet
really?
You'd love it.
You put electricity on it?
I do.
Okay.
Not always. It depends on the injury, right? Some people are way too inflamed to even handle anything added to it, right? But it's really interesting how it helps the muscles relax. And yeah, I had one guy who had back pain he could not get rid of. We did one dry needling and he said, I don't know if this is placebo or what, but I feel amazing. I'm
No way.
Great.
Has there ever been someone with an injury that you haven't been able to fix?
It's funny you say that because it just happened. I had to refer him out and I made sure that he knew, and I adore him, so I could say it, but I was like, you're the first that I haven't been able to, I don't have the tools to fix him. He has a disc herniation that's too severe, and so he really needs some decompression where you're set up to a machine that basically pulls you. You would love it.
Why do you think I love all this stuff?
I know you hate it because you've never been.
Okay.
So yeah,
She's trying to scare you a little
I
bit.
get it now.
yeah. And so he needed more than what I could do. And so I had to refer him out.
Do you ever tell people stop coming? I don't need to see you. There's nothing wrong with you.
If there's nothing wrong with them, I tell them we're shifting over to a wellness based practice. It's not. I'm not obviously not going to tell people I don't want to hang out with you anymore. So unless I didn't want to, no. But if I feel like their injury is resolved or we're not really moving forward, we'll shift and as far as how often we're seeing each other or what we're doing during those visits.
Did that failure make you want to get that machine that you needed to
I
decompress?
would love to be able to afford all of the things so that there is no one that I can't fix.
How much is that machine?
Yeah, what profession do you send it to? Is it another chiropractor with more money?
Mm-hmm.
Pretty much.
100%. Or either with more debt.
Yeah.
Whatever they had to do to buy it. But I'm not sure how much they run. I know it's over 40.
Dang.
Yeah. I don't have that.
And it
laying
just
around.
pulls their body apart, basically.
Slowly but surely. I mean, that sounds aggressive, but it's a well run machine.
Yeah.
Yeah.
It's just ropes and pulleys. It's like,
He's cracking up.
It's a 3, 2, 1.
yeah.
Yeah.
So look, I pulled the shit out of my hamstring a couple weeks ago.
Doing what?
Now I bet someone $100 I can beat them in a race,
Oh, gosh.
and I lost.
Yeah.
The last couple strides, something popped
Pop.
and like my hamstring leading up to my butt.
Mm-hmm.
And so like when I think chiropractic, I think like you're just gonna adjust skeletal things.
Mm-hmm.
But with a muscle thing like that, we talked about deep tissue and that's moving blood to that area. But like, and what really is different from needling to compared to like deep tissue? Is it still the same purpose, getting blood to the muscle?
It's all about getting blood to the muscle, really. Like every approach is trying to notify the body like, hey, we need healing over here. So as a chiropractor, you're helping the body heal itself, you know? And so it's ways to notify the body like, psst, over here, you know? And so like with your hamstring, was it a complete tear or just partial?
Oh shit, I don't know.
See, you need to go to a chiropractor.
For that,
100%. Yeah.
you can tell if I have a tear.
I can tell if you have a tear.
How?
There's different ortho tests.
Do you do the Miyagi thing? You're like
100%, just like that.
no, but what is the
No.
test is like not a machine test?
Not a machine test.
Bullshit.
Like all your orthos are going to be hands-on testing.
So I was going to ask you, can you touch an area and feel that, oh, this is
Tight.
No way.
Yeah.
Oh, you just know it's tight. How do you know if it's a tear?
A lot of tears are, so any strain is a tear. Any strain is going to be a partial tear. So you saying like, oh, I tore my hamstring, more than likely you strained it pretty good. But if there's bruising, if there's swelling, that lets us know different grades.
Yeah.
The
So-
only way to truly know would be to do an MRI.
Yeah. So I didn't have, that was the first thing we looked if it was bruised, and it wasn't bruised and it wasn't swollen. But like if I were to try to touch my toes and keep my legs straight,
Not happening.
no. If I want to squat down,
Not
and it happened
happening.
right before I went on a ski trip and could not ski at all.
Perfect timing.
Yeah. So I just hung out around the town.
Yeah.
So, but I had tried to get the masseuse. I was like, hey, go real easy on this part. And she gets up on the little bars and like starts stepping. And I literally grabbed her foot and I was like, stop. And she wouldn't stop. And
No?
it was, no.
Oh, that's the Thai place you go to.
Yeah.
Oh, I was like, what?
She didn't understand what I'm saying.
I
So,
was-
so I just had to,
It makes her uncomfortable.
I just had to deal with it.
yeah.
But I mean, what would you do with me? You just do like some needles and try to get blood over there?
So there would be different approaches. It would depend, but a lot of like active release technique, rehab exercises to really try and like increase your range of motion again and get it back moving well, help it heal.
Because there's a heal period with this. Like you don't want to just stretch this. It has to heal a little bit
Sure.
before you start stretching it out and stuff, right?
Yeah.
Who's telling who here?
I'm
know,
trying
right?
to teach her. Her dad shit me.
Yeah.
Her dad.
So do the needles have anything to do with nerves? Like you get in it, like when you're starting to put electricity on or whatever, it's all muscular, right? You're not, you remember, I think with like acupuncture, it's like do something here and it ends up here, like
Yeah. No, dry needling is going to focus more on the muscle.
direct onto what you're
Mm-hmm.
doing. Okay.
I have a package called Full Service, and there you go.
Oh, wow.
Yeah.
That's what you got at the Thai place, huh?
Almost. Almost.
So if we come in, is it like an insurance thing or
I don't take insurance,
so you just take cash?
cash, or take a HSA, your health savings account. Some
Oh,
people
that's
offer
cool.
that. Yeah.
Oh, that's dope.
Mm-hmm.
A lot of people are moving away
lot of
from the. Damn it. You're right, dude.
A lot
More
of
and more
Problem.
people are moving
That's pretty
away
good.
Hey.
I like
You
that.
like that
Yeah,
one?
that was good.
I like that
I
one
got the
today.
eyebrows raised, so she
Yeah.
really liked it.
Mhm.
They're moving away from insurance. Some people are dropping their
It's
insurance.
because insurance doesn't want to pay. And so a lot of holistic health, like mental health, a lot of your therapists are going away from being under insurance for the same reasons. Insurance wants to pay people that are handing out pills.
Yeah.
It's all connected.
But but all our data is being sold.
Mm-hmm.
So if you're text messaging or emailing about a pre-existing heart condition and it's not really in the medical books, like all that data, like we're just signing off our data all over the place.
All day, every day.
And so they're collecting all this data and they're saying, all right, you're going to be this expensive to us. And they could probably even predict when you're going to die. So
they
they're-
probably use AI.
Oh, everything. AI.
ChatGPT.
You just dump the emails in AI and they'll tell you like what's your
Your death
expiration
date,
date.
yeah.
Yeah. So that's what's going to happen. And then they're only going to cover you up until a certain point. And you're going to hit a certain age where they know you're going to be more vulnerable. And then they're going to up your
I
up
didn't
your rate.
want insurance, and my mom made me get it. She was like, "You buy it in case you need it," and I'm like, "That's like that's like loading up on groceries in case the store closes." You know what I mean? Like I can tell you this about me: if there were ever an apocalypse, I'm out first. Like just I don't want to.
Really?
Yeah. Oh no, I'm not one. I don't know anything about guns. I don't want to know about them, and they make me very uncomfortable. And so two, I'm not going to hurt somebody like in order to like survive. I don't see that. If ever there came a situation where I needed to protect like a loved one, I would probably see a different side of myself.
For
but
sure.
in the event of an apocalypse where we're all like days are numbered, like send me to God. Just make it quick and painless.
Really?
Yeah.
Whatever. She'll be going around doing hard adjustments.
This is
I know. She'll be like that person in Walking
you know
Dead.
all the moves.
I do know the moves. That's true. Gosh, maybe this is all just a setup. Like I'm just saying it, but in truth, I would be out there like pew pew pew.
Yeah. If you had kids or you're married, I bet it'd be different.
Yeah.
Or you're living with your mom, like you're carrying your mom around in the in the
yeah.
Yeah.
If it were my mom or my significant other, I would probably kill anybody for it. But I mean, my family too, the rest of them. But yeah.
Would you kill a dog?
Oh no.
What if you had to? The dog had rabies.
Well,
But
then
it was
I would be
nice.
help. Yeah. What?
Yeah, nice dog with rabies. Would you do it?
Golden retriever.
Golden retriever.
Oh, poodle.
Poodle probably. Golden
Just
retriever.
just had pups.
Oh, what? Are they rabies pups?
No, they're good. They're healthy puppies.
Well,
Healthy
then
puppy.
they need their mother.
They need
Why
the
am I
mother.
killing her?
You have to decide.
Between who?
Killing it or not.
But why would I kill
You
it?
just have to.
Oh,
It's the game we're playing here.
yeah.
Speaking of dogs, though, I want to get in. What kind of animals do you work on?
Mainly dogs, but horses. I've done donkeys, a mini horse. I've only had one of those, so just one. Basically, you bring it to me, and
Where do you do it at?
so
Alphaland?
they can't come inside.
Cow in there?
Yeah. They can't come inside, but there's a lot of grass around Alphaland, and so I will schedule them like a regular patient and just go out, have them walk on the grass, treat them, send them on their way. I have had a few that I needed to go to them, and so it's kind of case dependent. But obviously the horses aren't coming to Alphaland.
Yeah.
So.
Well, all right. So walk us through a dog. What do you do with a dog?
So you got to be quick with animals. I've also done a steer, but that was really hard because he was raising him for show, and he was like a big puppy. And man, knowing that you're treating somebody that
Is gonna get
Oh, wow.
killed. Hey, so it wasn't walking right. It wasn't showing right. You had to adjust it, or what?
it's just for this guy, he had like a little hump in his back, and we just really wanted to try and get him as like presentable as possible. But when a dog comes to me, depending on what's going on, right? Like you want to assess them the same way you would a human. And so you're just feeling for anything that might be a little off or a little more taut than the rest of the body. And then you go through and do your full adjustment.
Do you have the strength to adjust a horse?
I think so.
You do it with your body, or you do
I
it with
my
tools?
body. No, with my
How do you even do you just jump on his back? What do you do to?
yeah.
How do you get leverage to adjust a horse?
When it comes to the animals, it's all about leverage, right? And position. So you really don't need a ton of strength to move the joints. It's more so knowing the line of drive and knowing like what you're looking for. But when it comes to an animal that's larger than you, obviously you need to be up higher. So we have what are called like our bale, and it's literally like a hay bale, but made out of styrofoam. And it, depending on which shape it's in, is if it's taller or shorter, you know? And so you just climb on up and wham, bam.
Are you worried about getting kicked?
Yes.
You always have to be worried about getting
Yeah.
kicked, for sure. You
Have you
always
got-
have
you,
to be aware of it.
You got any
I have
close
not.
calls?
I have not. Well, I had a horse that did kick, but I was not in the line of drive.
Were you raised around animals?
Yeah.
Okay.
Oh,
Like on a farm or something?
No.
No.
I was raised on a golf course. And so I had dogs growing up, and then we rode horses on a pretty regular basis. So
well, that makes sense then. I just didn't know you had experience with horse.
mm-hmm.
What?
I should post it more. I really should, but I will.
My family does stock show or the Houston Livestock Show.
Really?
So
I'd love to get in on the rodeo.
Yeah, you're right there too.
Mm-hmm. I am.
That's a big deal when
Yeah,
your
it's
steer
hard to
doesn't
get in.
walk right.
Mm-hmm.
They spend a lot of money doing that.
They sell these things for so much money.
We buy the bad ones that don't make the show,
Yeah.
and we get it butchered.
Yeah.
So
You probably bought Champion then. He didn't
Maybe.
make it.
Champion.
His name was Champ. He was so sweet. And I swear the day that he went to show, he knew, and he just was laying his head in his owner's lap the whole day. Like,
It's sad.
It's terrible.
That's so sad.
Ugh, I can't. But I mean, it's quality meat. So
good meat.
Good meat.
Do you eat steak regularly?
No, I don't eat red meat at all.
No?
Mm-mm.
What does your diet look like?
So I try to eat pretty lean. Try to get in, about 80 grams of protein at least a day. But I usually start with like either a protein shake in the morning or some eggs, egg whites, things along those lines. Have a chicken, rice, veggie at lunch, and then usually about a salad at dinner.
So what
Lightweight.
do you have? Animal protein?
Chicken, fish.
Just not
Big sushi girl.
never red meat.
No.
No ground meat either?
I'll do turkey.
Do
Ground turkey. 99.1. I won't do the 93.
Oh my
Yeah.
gosh, he knows the ratios.
Yeah.
Do you well, why red meat? I want to just kind of pick your
Yeah.
brain. Why
Pick
you-
away.
Pick away.
When I was
Pop away.
yeah, when I was in second grade.
Oh, here we go.
I know.
A non-scientific reason.
Yeah. I was watching Oprah she did a special on mad cow disease, and
Oh.
I thought I wanted to be a vet at the time, and that was it for me. I was
Oh.
done. But my mom says even when I was a baby, when she would like try to give me steak, I would just I'm really a texture person. I don't like a lot of textures, and so I haven't really been into it. And I will say last year, somewhere around there, my dad was doing some steaks for my sister and my brother-in-law. And for whatever reason, I was like, those look really good. Don't know, didn't try it. But I know your taste buds change every 7 years, so maybe it's time to venture out again. But
Did you get into sushi late?
Mm-hmm.
Yeah.
Well, not really late. Like I was probably before high school. So no.
Oh, before high school?
Yeah.
Oh, okay.
I remember being at a soccer tournament and trying it with my cousin and my aunt and my mom. And yeah, my first sushi roll was a California roll. You're welcome.
Yeah.
Yeah.
I love those.
Yeah, I still do. They're great.
When I say sushi, that's usually what I eat.
What you mean?
Yeah.
Mm. I'm
California,
really,
is that what you-
California roll. Yeah.
Oh, okay.
That's the only thing I know.
I'm
We-
still
oh.
weird on textures. Like if my tuna, I can do raw, but if it has like the white little lines in it, like I'm out.
That means it's seared, right? Or are you talking about the
In between.
Yeah, yeah.
Yeah. No.
I do a lot of sashimi,
What's
Mhm.
that?
just the raw fish,
Yeah.
either just away from everything, or sometimes I have the nigiri that's
Yeah.
on a bed of rice.
Oh, I've gotten that with you.
yeah.
That's good.
I do less
That
and
is
less
good.
of the just the rolls, because now they're just getting crazy. There's like a damn chicken nugget in there with caviar and Cheetos,
Yeah.
and like they're just getting really Americanized.
Yeah,
So,
that's true.
so I don't know. But so do you think you're pretty strict?
With my diet?
I see your biceps. You look kind of lean.
Stop.
Can you flex one?
Are you serious?
Yeah, I feel like they're big.
They're bigger than yours.
They're all right.
Oh shit! They are
Well,
bigger
so
than
you did bodybuilding.
Yeah, I did 2 shows. I don't claim it very often.
last
but
week.
Yeah, it helped me to know how to help the people that I'm working with now. But because I know how strenuous it is on the body, but I hated it. If I'm completely honest, like it was not for me. I was never a beauty queen kind of girl, and I had finished playing soccer in college, and I was looking for that next like sport. And my trainer at the time was a professional bodybuilder, and so she was like, you should do a show. So I was like, I'll do it. And Yeah, it's like a beauty contest and less clothing. You're just literally up there asking people to tell you what looks good and what doesn't about yourself. And then you diet so hard, you train so hard, it's so taxing. You pay for your suit, you pay for your coach, you pay for your entries, you pay for everything. And then you win a trophy. And it's like, I could have had this trophy made months ago. And not only that, it's like, I remember after my first show, we went and ate, and I got to eat a noodle. I was so excited about this noodle, and, you know, your abs just vanish, and you'd worked so hard for them. And then, so for me, it was a very emotional, taxing recovery, because it's like, I went through all of that. And now it doesn't even look like I did anything.
How quickly it goes.
It's so fast. And it takes you so long to get where you want to be. And then it's so fast to just like lose it. I was like, who does this? I'm out. So the second show was we were going for my pro card. And I had no idea what that meant at the time. But I was like, cool. And so the girl that won, she had no definition. And so she got up on stage and she just worked the stage. And I was like, good for you. But like, you know, you don't have any definition. So your confidence isn't going to get you there. Yeah, it is. She won. And I couldn't believe it. And so I had vodka in my shaker cup by the end of that show.
It's such a weird sport because it's all subjective.
It's so subjective.
There's no black and white.
They have guidelines, but it's really hard to hone in on those guidelines, because at the end of the day, it's going to have the judge's opinion in there. You know what I mean? Like, I don't know.
Are the judges old people or are they young people?
It depends on which show and where they get them from and all that jazz. So, yeah. I mean, you could do 2 shows, right? Like, let's just say I don't think it would happen, but it might. You could do 2 shows in the same weekend, right? Like just back to back. Go to the judges and be like, hey, what do I need to improve on? And they could be like, Laken, your back just needs to be bigger or more defined, whatever. Next day, different show. The judges could be like, your back just has too much definition. And you're just like, cool. You know what I mean? Like there's just no pleasing everybody. And so I need a sport that's more like, I won because I did X, Y, and Z. You know what I mean? Like if we go play basketball, we know the person that wins is winning because they made the most baskets. You know what I mean? Like I just can't. It's not for me. But
it's impressive though, the commitment that goes into it.
The discipline is insane. I mean, I admire it. I was in my Bible study last night, and there's a girl in it that was doing cardio during the study because it's her off season. She's not even in prep, and her coach has her doing 6 days a week, 40 minutes of cardio, and she's already lean. She walks around with abs, and I'm over here like, why? You know, like
why?
I don't understand. But to each their own. Everybody in the study was like, you might need a new coach. She's like, this is a new coach. I'm like, you might need a newer coach. Yeah. You know, like try again.
She just got on the Instagram, typed in online coach, and she found that person.
Yeah. I always ask people, I'm like, where'd you get your coach and what are their qualifications? Because like I said, you don't have to have any education to be like no certification, no nothing. I could just.
Is it an influencer or is it a coach?
Right.
You know what I mean?
I'd rather have an influencer.
I bet you would.
I bet you would.
Me and Jon want abs pretty desperately.
Yeah.
Is it not attainable? Or it's attainable, but is it like if you have like one cheat meal a week,
it still should
be. Do you think you could have abs still?
Yeah.
Do you have abs right now?
No.
I feel like you do.
Thank you.
Thank you. We were running for a while, a couple of years, really hard, like 50, 60 miles a week.
Wow.
And
we're like marathon training, so it's like we're doing a bunch of miles. We're doing ultras.
No abs. And that's when I got into keto for a little bit.
Oh.
Pretty hardcore. I was making the tortillas with cheese and stuff. Mm-hmm. No abs though.
Yeah.
I did.
Keto will make you drop weight pretty quick, but it'll.
I was pretty fat. I was like
back.
I was like 220.
220. Oh wow.
Yeah, I was fat, dude.
So he's probably the leanest I've ever seen him. I never seen him in high school, but so
what's
what
your
is
story? How do y'all know each other? How
We
did this
dated
happen?
for.
how long have you been
Yeah.
married now?
We worked together. I met him at the
At
company
work?
we work for. Yeah.
Okay.
So
Nice.
we
Just became fast friends.
no,
Oh,
we almost fought each other a couple times when we were drinking.
No. Hey, that's what we'll go to.
That's what happens. That's what happens.
Yeah.
So no, we just started doing the podcast. We started during COVID. We wanted to help promote local businesses,
oh,
and that's still the mission. We still want to promote people from Lake Jackson, Houston, Angleton. You know, it's free advertising. They get to
Yeah.
come, and it's cool learning about your
New
background.
people, yeah.
Like you're a bartender, and no one would really know that. And
yeah.
on a wide scale anyway. You know,
Right.
it's on YouTube, it's on everywhere. So we wanted to do that, and then
Sweet.
we're both into fitness. So
It doesn't look like it, but
it don't look like it, but we really are.
I'm like a spectator. Of it. I like it a
You
little
remind
bit.
me of the guy from Lady Antebellum. Have you gotten that before?
Oh my gosh.
All the
I
time.
used to when I was.
Josh Kelly.
attractive.
I think is his name.
I don't know if he's attractive anymore. Is
I don't
he even-
know.
Are
Yeah,
they even a
sure he
band
is.
still?
Yeah, I don't know.
I remember he's like, oh yeah, you know.
Oh, you sound
Yeah.
just like him. Yeah.
Yeah.
You
I
should have
practiced that
seen
one.
Mike, what, 6 weeks ago? I got to show her a picture.
Oh
Is
yeah.
it the long hair?
How do you? Oh,
I saw it on when I was playing with the cats.
Oh,
I
okay,
saw a
yeah, yeah,
family
yeah.
photo.
Okay,
so
yeah.
I assumed it was you.
Yeah.
creeping on me, huh?
Long
Yeah.
hair.
Observant.
She's
Yeah.
observant. She's a doctor, dude. She's smart as shit.
I don't know if she's a doctor.
Oh, yeah.
Some of the family might disagree.
Is that Jerry said, did you watch Seinfeld?
No.
Thank
No.
you. He always tries it with people, but
Most of the people
don't
like it.
like Seinfeld.
Do
I
you?
hated it growing up.
Did you
Thank
really?
you.
Yeah. I
Damn it.
hated
What show did you like that is like your show?
Me?
Yeah.
Like now?
No, like growing up that we
Growing
always.
up.
Oh, you like Adam Sandler? He's in love with Adam Sandler. Do you
That's-
like Adam
No,
Sandler?
he doesn't like Adam Sandler. So he
It's
just
not
goes
that
to-
It's not like I don't like him.
His comedy has gotten worse over the years.
It's got, yeah.
It has, but I
used to be
did
good.
enjoy all of his movies growing up.
But we're talking about movies, so like you're
Yeah,
talking
but
about
movies and shows are different.
shows or
I'm just a Jerry Seinfeld fan, though.
Okay.
I like his
I've
observational
considered
comedy.
going back and watching it as an adult because obviously I would get the jokes now.
Yeah.
You know, maybe that would make.
Were
a
you
difference.
raised in a conservative household? Were your parents pretty conservative?
They might would
Like
say
old
yes.
school?
No,
Like
they were pretty laid back.
my parents is very R-rated house. So
Mhm.
those jokes, those sly jokes on
Mhm.
Seinfeld, I got when I was really young,
Good for you.
and I shouldn't have though. You know what I mean? Because
Yeah.
they're kind of dirty jokes.
You were ready for the world.
My daughters don't get the jokes either.
Oh man.
because they're not funny.
There's-
They just don't. land.
They're funny, dude.
She's funny. You have like
Thanks.
a comedic timing. I see
Yeah.
some punchlines in there.
She's
I can
punchy.
see you as. Have you watched The Office?
Yeah.
Okay, good.
Yeah.
But do you like Parks and Rec?
Yeah.
Like more?
Then The Office.
Yeah. I'm shaping you out here. I'm
Yes.
doing an adjustment right now.
Yeah.
Hey, pop.
You do like Parks and Rec better than The Office?
Yeah. I
Okay.
watched Parks.
Dang it.
I say that based off of I watched Parks and Rec more consistently,
Really?
but I do like them evenly.
What's that other one? The
Sunny?
no,
you watch Sunny?
there's another
Mm-mm.
one. The with the
didn't watch
scientist
Sunny.
nerds with the scientist
Oh.
nerds.
Oh, Big Bang.
Do you like
Yeah.
that one?
I love
Obviously,
that one.
she likes
Which
that
one do you like more?
Big Bang. All
That's
day.
my wife will laugh so hard at Big Bang.
Because the jokes are so good.
They're good.
I don't think
just
they're funny
figured-
at all.
'Cause you're dry, so I
Yeah.
thought The Office, but
Yeah.
no, The Big Bang's funny.
Big Bang is funny.
Yeah.
Did you finish The Office?
No.
That's the
I
that's
couldn't.
the fucking problem.
I couldn't. I can't.
And you.
I can't. We tried watching a couple episodes
It's
without
not too
Michael
late.
Scott.
can
It's
go back.
so good.
Yeah.
Did you
It's-
stop when Michael left?
Yes.
Yeah.
So that's
Same.
the thing. There's fans that stopped when Michael left, but it really is a good show after that still.
Mm.
But
It's
like
subjective.
it's nice. It's nice once you finish though, you go back to Michael
Yeah.
like in the beginning again. So it's
Mhm.
nice to have him and not have him, but he definitely
Michael made the show, though.
He
man.
did.
It was
I
Michael.
love that they asked him about doing a reboot, and he was like, "The world wouldn't handle the comedy well anymore." And I was like, "So true. Everybody's so sensitive now."
Yeah.
if you go back and watch them, they're pretty
They
bad.
are,
There's
though.
some
They're
the
pretty
gay
bad.
jokes. The
Oh,
gay
dude.
jokes that he makes.
But
All
they're
the-
good.
Yeah.
They're really
Yeah.
funny.
I mean,
They're good.
it goes to show people like it.
Yeah.
People love the show. So, I mean, and that goes along with the humor and stuff.
The comedy, that style of comedy is making a comeback, though.
I don't know.
You don't think so?
Mm-mm.
You think?
I think the world is too sensitive and that they just get their feelings hurt over everything.
Right now, but I feel like
You
more.
think that's going to change?
I think so.
I hope so.
I think it'll go in circles. Yeah, wave circles,
It's
whatever
like
you want
a
to call it.
circle.
It's like a
Yeah,
circle.
it's like a circle. Circle.
Yeah.
I think so.
Well, some of the I think we're in a bubble, like this Joe Rogan bubble, where we see all these comedians and there's all this, like
Being in Texas?
He's one, yeah. Well, that's one thing. Everybody's moving to Texas and Florida, which are
Yeah.
more conservative states. So you think that some movements there, but it's also like people are getting canceled and they're able to come back too. It's
Mhm.
not like they're just completely getting canceled
Cut off.
altogether. Yeah.
Yeah. Look at the Dixie Chicks.
Oh, dude, they
Bro.
were the first canceling. I
Yeah.
feel like,
And
they got canceled for a long
Well,
time.
they got
They got
can-
canceled
what's-
hard.
What's funny is they got canceled by the Republicans
Yeah,
because they criticized George Bush.
sure did.
And
She
now
said he's an idiot, right? On like an award show.
I don't remember exactly.
I don't remember
Our president's an idiot, I think she said.
something like that. Something like that, but it was
It was
George Bush.
Wow.
and they canceled the shit. It used to be, think about Tupac. Those days, the
Mhm.
Republicans were wanting to silence music, and now it's shifted.
Yeah.
The Democrats are
That's true.
are wanting to.
Do y'all consider yourselves more conservative, or
I don't want to. I think I'm in the middle.
okay?
I don't want to
Label yourself.
label myself to
Yeah.
a side because there's stuff that.
Do you agree with on both sides?
Yeah.
Yeah.
Oh,
That's fair.
I see you gripping you're starting
What about
to
you?
ball
Yeah,
your
no, she's
fist,
like,
so
she's like.
I
How
kinda
dare
see-
you? No,
Oh
no.
God! What would you consider yourself?
I would say that I lean more conservative than liberal, but I agree that there's things that I agree with and disagree with on both sides.
Yeah.
So
Like blocking Pornhub? That's stupid.
you're mad about that.
You can't say. Well, I'm not really mad about that. But what I don't like is
Brought
that.
it up twice.
I know.
It's in his brain.
Yeah.
It's the most recent thing. So Google News. Do you use Google
Mm-mm.
News? It's pretty good because it'll learn what you want to read.
Oh. Okay.
So it knows that I want to read vegan news. It knows I
You're
like.
vegan?
No,
You
Okay.
just
I just want to share stuff
please
that's
don't bring it up.
anti-vegan.
Don't
All
bring
right.
it up. Please don't bring it up.
Mike was vegan for a long time,
All
so.
right. That's why he cut his hair. He's like, I'm not vegan anymore.
Yeah.
I can't have long hair.
So it knows I want to read about vegans, carnivore diet, and all this stuff, and that's one thing.
It's literally
like
opposites, but continue.
like Texas politics, so it'll bring up Texas politics for me, and that's
All right.
what's trending. So, but I don't like how you can say that you're for freedom of speech, and like we want to stop banning us, but then we're going to limit you to go to a website at the same time.
yeah.
That's
That's
hypocritical.
literally opposite. Yeah. It's true.
So
I think
Make it
the big
make
divide,
sense.
the big divide right now is like the whole women's, the abortion,
IVF
um,
or oh
the abortion, like your woman's
Woman's
body,
choice,
their-
right to
yeah,
choose.
the right to choose. That one's like a big divide where maybe a lot of people are on one side, and then but they have this belief in this one thing, so it doesn't really technically mean they're completely one sided.
yeah.
So there's some that are like where I've kind of believed too differently. So it's you can't all say like you believe everything in one party. So it's kind of
Right. Some overlap.
hard to say
there.
that you're
One or the
completely
other.
one. Yeah,
Mhm.
yeah.
but
That's true.
there's a lot of religion and on the right too. So that keeps
Mm-hmm.
that alive.
I would argue there's a lot of religion on the left too. Well, Dr. Laken, we're severely over your time. I don't know if you had anything planned. I hope not.
I blocked for a bit, so
Okay.
let me check my schedule real quick. We'll just take a look. I should.
She
be
missed like
fine.
7 appointments.
Yeah.
Right. Everybody
Things are
left.
just popping off.
Yeah.
Dun, dun, dun. Well, the Wi-Fi. Oh well.
She's probably really good at adjusting her schedule.
Well played.
Mike is really good at those
The
jokes.
puns.
Yeah.
I'm
I'm
here
trying
for
He's
it.
not real good at anything else, but he's good at those.
Look at her
Okay.
bicep. She's like,
Stop.
I saw
I
the
don't have
bicep.
anybody until 4:30, so we're good.
Okay. We'll go for a little while long. I saw the biceps when you were walking up. So is it weird coming to a house to do a podcast that you haven't been before? Obviously,
so
it's a little weird
I
as a
shared,
female.
I shared my location.
with your dad.
No, my parents don't know I'm doing this, but they'll find out. I just wanted to hear it first before I let anybody else know about it, because if I hate it, then I'm not gonna tell them. But I did share my location just to
Yeah, it is a little
cover my
sketchy.
grounds. Yeah.
Sometimes girls come with guys, which is good. That's why we got the chair right there. So
Cool.
Yeah, we wonder about that though, because we know we're harmless, but then it's not always with girls either. It's just like you're coming to a house. It's not really like a studio, and then we have to do like a lot of cold calling.
So kind of like I did you. I saw Shannon.
Yeah.
I don't know. Yeah. So she's a good friend of ours, and she's been on the podcast a couple times.
Yeah.
So
Okay.
Because she had a Happy Bean project for a while where she was giving back to the homeless. So
Yeah.
Well, she just changed it to something else. But we had the mayor of Lake Jackson on.
Okay.
And then the mayor of Lake Jackson was like, hey, there's this awesome nonprofit called the Happy Bean Project.
Oh, cool.
So then that's how we met her.
Nice.
And then she started her like lingerie business that she was doing for a little bit. So she came back on and we talked to her about that. And then I saw her share some of your videos. And that's awesome. That's why I reached out.
I was curious.
Yeah.
it's all connected.
There we go. It's all one body.
We're all one thing.
We're all one thing.
I love the eyebrow raise. It's the eyebrow raise for me.
I think she would understand if I did it that way.
Yeah.
That's right. I got it.
Is there anything that we could do differently that would make it less awkward? I feel like we try to make you feel as comfortable as possible when you come in.
Yeah.
Because you don't know us.
That's
it's a little weird, right?
It's all, just a trusting.
Was it weird? Was there anything weird right off the bat that was like, oh God, this is weird?
No, I think maybe telling people like, hey, it's at my buddy's house so that they know they're at the right place because I didn't have a clue.
That's fair.
And so
Yeah,
I was like,
that's fair.
I
Do you
don't
tell
know.
people that?
I just give them the
house?
address.
Okay, that's what I
what you
did.
did.
That's
Yeah.
what I did.
You
But I
don't know
mean,
where you're driving.
if you Google it, I mean,
I
if you put
figured
it
that's what
I
in
guess I could have done that.
maps. It's just you'll see a neighborhood.
Yeah, I guess I could have done that.
Yeah, come on.
Yeah.
Yeah, we
But
need this feedback.
Some businesses are literally run out of houses. Like Heidi, who is married to Christian.
Buff Bunny, right?
Bunny, yeah. Her, right now, I mean, she just bought land and so they're building. But right now, her business is run out of a townhome. And it's a multi-million-dollar company. So, you never know. Never know what's behind the door.
Yep.
It doesn't make sense anymore, really, to have a storefront in a lot of cases.
Mm-mm.
I mean, John has a company and he just runs it out of his house.
There you
So
go.
$100 company.
Yeah, multi-hundred weekly. Just started.
What are you doing?
We sell skincare products.
Oh, okay.
Started with skincare, and then we want to move into like household cleaner
Did
stuff.
you give her bag?
Not yet. I was going to give it to you.
Oh,
I'll give you
geez,
samples
did I ruin it?
I love
afterwards.
some samples.
Yeah.
Love some skincare.
So where we work is a reason why I started doing it. So
Interesting.
my daughter was breaking out really bad,
Mm-hmm.
and I told her to bring down what she was using, and the ingredients on her face wash and her whatever that she was rubbing on her face, her moisturizer, was everything that we make at the company that we work at.
That's crazy.
And to me, like, we know what the operators, that's what we call them, the operators that handle all the stuff, they have to wear so much skin protection
right.
to handle those things. And then at the end of the line, it just put in a little tube, and then they rub it on their face.
Mm-hmm.
So that was like that was the, when I read the ingredients, I was like, well, no shit.
Yeah.
You're breaking out and you're got weird rashes on your face. So then we started looking at everything that we use in the house for our skin, our hair. And I was like, what the fuck are we doing?
Yeah.
So then,
It's crazy because, like,
It's crazy.
it's crazy, right?
It's
Wow.
It's so crazy.
I didn't even make it through one podcast without adopting it.
I love it. No, you had it. You had it.
It was
you all
in
the
there.
time.
It was in there. Yeah. I'm very anal about my dental routine. And yet every time I go to the dentist, I feel like they're like, cavity. And so I finally told him, I was like, it's really making me wonder if my products are even doing anything. And they were like, oh, yeah, of course they're working. I'm like, of course you're going to say, of course they're working. But in my mind, I'm wondering, you know?
Have you seen, are you on TikTok?
Mm-hmm.
Have you seen all the videos of oil pulling?
Coconut oil.
The coconut, yeah.
My wife has been doing that for a long, like forever. No cavities.
Does she also use minty products or no?
You know, I will buy ones that don't have the fluoride in them,
Mm-hmm.
and then she'll use that too. But she likes to use Sensodyne.
I
But I'm trying.
Sensodyne, but I need, like,
I'm trying to get off of fluoride.
I love Listerine. I
That's so
drink
bad
it.
for you.
I drink
I want my breath to like knock you out because it's just so minty fresh, you know? And so I don't know what my replacement would be. Maybe chewing on a leaf of spearmint. That might
Well,
do
they
it.
say that breath.
They do.
Oh shit! Damn it, man.
All of them.
People people say, is that better? I've heard that breath has
There
a
you
lot to
go.
do with your gut health.
Oh yeah.
Yeah. But I also feel like you can always make your breath better,
Yeah.
you know? So
Just a little adjustment.
Do you drink
Just a
coffee a
little-
lot?
not a lot, but every day.
Yeah. I do. That's good.
So I use this toothpaste called Essential Toothpaste. It's the brand is Essentials, and it doesn't have all that other
Yeah,
stuff.
that's a good
I got
name.
it from a.
Nice.
I got the advice from a dental hygienist. you know?
Oh.
And so I use that. But yeah, like when your toothpaste
that fluoride?
are like taste like mint or taste like bubble
Mhm.
gum or whatever, you got to think that you're probably giving
Probably
yourself
not
calories.
great. Yeah.
But that Listerine, what was that study we read about Listerine like a couple years ago?
Oh shit.
What was it doing? Because I used to use Listerine too.
Mhm.
Well, it doesn't it like had something to do with like a neurological.
I think it even made
impact.
your breath worse.
Don't tell me that. Don't tell me that. There's
Yeah,
no way.
Over time, I think it makes it worse. Do you
No
have
way.
some with you? Did you ever do the Listerine strips?
Oh yeah.
Oh yeah, those are so good.
I know.
I did like 3 of them, put them all over the tongue.
Mm-hmm.
Yeah, everybody in school was like, "Hey, you want one?
Yeah.
Pop it open,
I know
little
the
strip,
pop.
Yeah.
dude."
Those are
Good
so
stuff.
good. Yeah, fragrance.
Mm-hmm.
Fragrant. Well, just fragrance in general and skincare.
Oh, yeah.
When it says fragrance, it can literally mean hundreds of other ingredients.
So I had a TikTok sent to me last night. This is kind of related. Of a bird that had died from Teflon. Have you heard of that?
Yeah,
Mm.
yeah. Well, they made a movie about it.
Have you
Dark
seen
Waters?
Dark Waters? Dude, write this down and go watch it.
Yeah,
Okay.
I'm
'Cause it's
gonna write you on IG. Watch
Water.
Dark Waters.
it's all about Teflon.
Really?
Yeah,
Yeah.
and that it's in basically everybody's body in the entire world.
What was your question?
What do you cook with? On what kind of pans do you cook with?
Teflon, I'm
Teflon,
sure.
oh my
yeah.
Oh
God.
no,
The
You gotta get
caraway
off of-
pans.
you're doing all the right things, but
All
the
of
wrong
it.
way.
Yeah.
You got to get off of those.
Mm-hmm.
You use the seed oils and all that.
I use avocado oil.
That's good.
Yeah. I mean, I try.
That's
yeah.
good.
I'll be surprised if you're.
She
with us
looks
next
way
year.
better than us, and we're telling
I
her things. We're telling her things that she needs
You
to
should
do.
be doing this.
Yeah.
How do you keep your pots not sticking to the
So-
things?
Tallow.
Cooking, yeah. Cooking on nonstick pans is the biggest sales lie
Yeah.
that we bought into as Americans.
That's the biggest.
It's one of the biggest
All right.
because stainless steel and cast iron pans
Cast iron is always great.
are nonstick
Okay.
if you just cook in them right.
You have
And you
to
cook in butter, tallow, ghee, anything that's, or even avocado oil because it has a high smoke point.
That's a low heat oil, isn't it?
No, I think avocado is high heat. I think butter is low heat. Olive oil is basically no heat. So we've had a bunch of podcasts about like with experts.
Uh-huh.
One of them is Dr. Ali Cohen. She's she researches like how chemicals impact your body, and a lot of the focus that she does is she focuses on plastics. And so we've talked with her.
Yikes.
She just wrote a book. She's going to come back on in next month, I think. But she's done a few TED Talks. She's awesome. But that's for me. Mike's kind of always been in this space.
He's never listened to me.
No.
If it comes from someone else, it's
Right.
like golden.
Right.
Well, because
He's like, hey, did you hear about this?
And
you're
I have
like,
to hear it, and I'm
"Remember?"
like,
Yeah.
well, because
I used to care. I
Mike
don't care.
knows, but he just doesn't practice it.
I used to.
Used to. So I want to know. I want to see someone doing it for a while, and then I do it, and then I become obsessed.
Okay.
And then I threw out all my plastics, all the
Yeah.
Teflon. We threw them all out. We spent like
See, I'm like super OCD, right? So everything in my house is very organized. I like for my house to look like it's up for sale at all times. And
like
so when you open my cabinet for my Tupperware, that's the one that I'm like, I need an alternative that can stack as well.
Glass.
It
Yeah.
doesn't.
Glass.
No,
Yeah, they make the different sizes.
yeah.
It's still bulkier than the plastic.
Oh yeah.
The one thing that every expert that we've talked to on the podcast has said is there's one thing that you can do to tremendously have a positive impact on your health. Stop cooking in plastic.
Dang it.
It all leaches to your food.
Yeah.
It causes they're endocrine disruptors.
And that's how the birds die.
Yes.
Yeah.
So that person that reached out to you really cares about you, and I think you should
That's what I like to hear.
you should
Shows
send them
Mike.
a TikTok back that says you care too.
You should make
Yeah.
a TikTok and say thank you.
Thank you.
And
That's
send
how we
it to-
communicate now.
Yeah.
It's TikTok. So
Well,
not about
only for a
words.
little bit longer. They're trying to ban it.
They're going to ban that too.
Yeah.
Which will go first, the porn or the TikTok?
Well, the
or
porn's
TikTok?
already
Porn's
gone.
gone.
Porn's gone already. You
Porn's
gotta.
gone.
It's not gone. There's an age verification step you have to do.
That's it?
When
Which,
they're
if
all-
you're in a rush,
Unbelievable.
you know what I mean. If you're in a rush,
Unbelievable.
if you're in,
This
What do you
guy.
gotta,
Did
you
you
gotta
like-
click, you gotta
did you-
click, you gotta click yes. Or
did you like
I didn't
that?
have time to say when my birthday was.
If you're in a rush, I don't want to put that shit in there. You know what I mean?
Unbelievable.
What if every video you had to verify?
Oh no, I don't
Man.
know. I don't know.
That'd be tough.
But yeah, no TikTok. They want to break it up and sell it, right?
I don't know what they
The
want to do.
US, that's-
I just know they want to
It
ban
passed the House, so now it's going to the Senate.
Well, they're
Yeah.
mad because they're making a lot of money,
Mm-hmm.
right?
I think
the
that's
main. Let's
Honestly,
be real.
I think that's
I'm
the
mad
majority
that
of it.
so many people are making so much money off of it myself.
Oh,
like,
God.
No, oh, you think it's because people are making money or the company's making a lot of
Oh.
money?
The
I think
company.
I
company's
think the
for it.
company is, yeah, I think that's what the U.S. is mad about.
They want a
But
piece.
me personally, it's a struggle to be surrounded by so many influencers that are making a killing a month. I mean, we're talking $50K a month minimum.
People that you know at the gym?
Mm-hmm.
No
Just
way.
by showing, is that mostly
Just by
females?
TikTok. No,
Males have more, make more.
yeah.
They're
See, I thought it
attractive
was-
though, right?
Well, the ones that I know that are making a good living.
Do you
are-
think they're lying?
No, I've seen numbers.
TikTok, I
Shit.
think, pays the most because I saw like comparison. This girl that was popular, she went through all of her accounts and said how much she made for the same video.
Oh, you sent me that.
And TikTok was paying like,
I think YouTube pays the most
Well, depends
on
on
views.
long. I think, yeah. Well, long form content wise, I don't know. We could
Okay.
probably look it up.
I don't know. I'm not anywhere close to making money.
We
off
make
of any
for
of
the
it.
small for our business. We make sales off of TikTok, so it does. It's beneficial,
Yeah.
but nothing where like influencers are making.
is that mine?
It's not mine.
What was
Jeez.
that, dude?
Well, Theo Vaughn. Oh, it is.
That's rude.
Well, now it's gone. It's TikTok. You know, when you watch a video, it just
I
keeps
know, it
playing
just
in the
keeps
background.
playing.
It comes up on my radio when I'm Bluetoothing.
Yeah.
Like when I first get in there, it just plays the same sound over and over.
You're
And
trying
I'm
to figure out where it
like,
comes
where the fuck is it coming? Like my phone's white.
Who's in my back seat?
They make a lot of freaking money off of TikTok.
Mm-hmm.
But
At
I
the end
think,
of the day, I think they're just mad that China came up with it before him.
yeah,
You know,
TikTok came
think
on the
so.
scene and has more followers
We had
or more
Vine.
subscribers.
Yeah,
I know we
why
have
did
what
Vine go
happened
away?
to Vine?
They set the way for TikTok, and why did
Literally.
Vine
They-
just die?
Didn't Facebook buy Vine and then just didn't do anything with
Yeah.
it?
Oh, I don't
Facebook
know.
or Meta, they buy all the things
All
that
the
are
things.
good and then they just don't do anything with it.
So rude. Just so they can have domination.
Yeah.
Yeah,
It's rude.
they didn't really do anything with Instagram either, and they didn't like. There's some
And now
wait-
there's Threads. Like, what
Oh.
is that?
Ah.
I can't even. I won't.
I
do
can't
it.
keep up with
I
it.
can't do it.
I can't keep. There's too many. There's too many of them.
Mm-hmm.
Do you have TikTok?
Yeah.
Okay, that was the one that I stopped downloading. You know, it gets
Yeah.
so many, and I just never downloaded TikTok.
When I started my job, they said you're going to need to increase your social media presence. And I said, well, it's 0. So it can only go up from here, you know? And so that's the only reason. I only have TikTok for my business, and I only have, I had a personal Instagram, and I have a professional Instagram, and then Facebook, but I don't use it very often at all. So
Do you have a person that comes and records the content for you, or do you just pop up a tripod and record yourself?
I lied. Okay, so I'm trying to get better about popping up a tripod and just talking to it, but for me it's so
uncomfortable.
weird. Yeah. I really struggle talking to my phone like it's a friend. And I see how other people, like I'm surrounded by millionaires and I'm surrounded by these people that have made such a comfortable living treating their phone like a friend, you know? And so I'm like, why can't I make my phone my friend? But every time I try, I just am like Ricky Bobby, like I just don't know what to do with my hands and I don't know what to say. And it's just not a natural thing for me.
A pet peeve for me, and I do it too, is this thing when I'm talking to the camera. It's like,
You're playing the piano?
or you're doing something, right?
Yeah.
So it's like, well, you do this or you do this, something with your hands.
I've had videographers that are like, you need to use your hands more. You're not being expressive enough. Oh, yeah.
So
because
using the
people
hands is
pay
good.
attention to you more because of your hand movements. What's weird is like when I'm just in my natural element, I do talk with my hands a lot because I use my hands a lot. But when I'm thinking about it, I'm like, don't.
I think I use my hands a lot too.
Yeah, exactly.
Whenever Mike posts the clips from the podcast, I'm always doing like making a pizza or something. Like, what the fuck? Yeah.
You're thinking about pizza. It's probably the core of it.
Yeah.
Mm.
Yeah.
I thought you'd feel that way just by your demeanor, that you would think you're bullshitting yourself up there.
Yeah.
Yeah.
And like, no, like the people that are commenting on your stuff, you will probably never meet them.
Are they even real?
Are they real?
You said that
know?
this account had so many grammatical errors. Like, is that even real, or is it just?
Well, I borrowed my friend's phone and went and looked at his profile, and it was a lot of political stuff and like reposting, and I was like, he's already angry.
Yeah.
And I didn't engage, and then 5 hours later, he came back and left another comment of a clown emoji, and I was like, you're just trying to piss me off, you know?
Yeah.
And again, I didn't engage, and I think he moved on.
That's
so.
your biggest strength, is to not
Yeah.
say anything, because they're just
waiting
ready.
on it. They want to
want it.
fight. They want to fight. They're like that guy at the bar at 2 a.m. just looking for somebody to hit, you know? And it's like, don't give him, let him hit your shoulder and keep going, you know? So it's definitely been an adjustment.
You beat me to it. Yeah. You don't want me to attack you for that.
Yeah. Because before, you know, I just stayed in my own little bubble of friends on social media. And now I don't have a huge following, but I have people that I associate with that are big influencers. So indirectly I get comments and things of that nature. And some people are just really mean. And it's like, who hurt you? You know, like schedule an appointment. Let's come in and talk about it.
Yeah. Let me give you a little adjustment.
You're a salesperson now.
There it is. You need 10 visits in 2 weeks. I'm just kidding.
Good
luck.
luck.
A lot of it.
Yeah.
Can you boil it down to jealousy, you think?
You always say that.
I
think
a
it's
lot
jealousy.
of it,
Well, I say that to you
I think
because
it's
you don't like Big Bear.
Yeah. There's some internal issues of themselves. I think you maybe you said that earlier.
yeah, that was with the drinking. Like when people are like, why aren't you drinking?
Yeah.
I think it's a reflection on, you know, self-deprecating or whatever.
Maybe it's not all jealousy, but it's something like, look at her. If you are interacting with influencers that are widely known, like, you know, why is she doing that?
Why her?
Yeah. Maybe it's some jealousy to it.
Maybe. Thanks.
Or maybe there was someone who failed out of school and
There's a lot
they
of
wanted to be a
those.
chiropractor, but they failed out of.
There's
they
a
couldn't
lot
do
of
it.
those, yeah.
What if they did?
What if?
Maybe it's just a bunch of failed chiropractors
Maybe.
out for your blood.
Yeah.
Yeah.
Maybe I should just be like, what try did you fail out?
Yeah. Who'd you
Let's
kill?
talk about it.
Who'd you kill?
Who'd you kill?
Did you? Yeah. That's kind of unfortunate.
What was your question going to be? Did I what?
I think you made me draw a blank.
Oh, okay.
Oh, I think you should, if you don't already, I have looked at a couple of your videos, but you need to lean into this little dry humor thing. You're funny.
Thanks.
Yeah.
I don't know how to lean into it.
Just be yourself. Like,
but when I turn the phone on,
it turns out.
Yeah. Like I have told people before, if I was just recording, I could still be me and be fine. But as soon as you like want to make it, like there was the first time I met Heidi, she was like, do you mind if I ask you a question on camera? And I was like, no, that's fine. She obviously never used the footage because she had this tiny little mic, and she asked me a simple question that I should be able to answer in my sleep. And I just froze. And it was literally like the Talladega Nights when he's interviewed the first time. And I am surprised that she even came back to me ever again, because I felt like that was, I couldn't even speak. Like, I just couldn't even formulate words. And it was one of those, whenever I finished stuttering my way through it, she was like, okay.
Thank you.
Yeah. Well,
Bye.
You tried. You tried. You did your best, and we love you for that.
It's a muscle that you have to work.
I guess.
To work at.
I have gotten more comfortable, but still not by myself. Like I'm comfortable in this type setting, which is strange because this is my first podcast, but I like it. And then I'm comfortable, like, yeah, if it's just me, it just feels like, why would you want to listen to just, hey, like, I don't know. It just feels more disingenuous or something. I don't know.
Yeah.
I need to figure it out, but yeah.
Well, people start to think they need to be a different person on the camera.
Yeah.
And then when you know it's around, like if I ever fixate on this thing here, then it would be one thing. But every time we get on these podcasts, we
cut up.
Forget that we're even filming it, and it's really, I always talk about the headphones because we're talking kind of far away, but we're in this little bubble right now. And once we're done, it's like, where were we for forever,
Yeah.
It's like you're in a different world.
Little dimension. Important question that wasn't discussed. Modern Family, yay or nay?
Oh, crap.
Damn.
I watched some of it.
Yeah.
That's a missed opportunity. That's a great show.
Was that on Fox?
I don't know.
What was it on when we were growing up?
I don't know. I think so.
Was it on Fox?
There was a lot going on that show. There's like 3 storylines. They had the gay couple, which were funny. The daughter. Now some of that one daughter's like famous for like going from like a skinny little girl, like this busty girl. Do you know which one I'm talking about?
Mm-hmm. The Ariel Winters.
Yeah. And then one of them became kind of like a singer. The pretty
Haley.
Yeah. I don't know any of their names.
Yeah.
It's a good show, but
great show.
Never got into it.
Okay.
You watched the whole thing?
Mm-hmm.
How dare? Why not The Office?
I know. That's why I was
You're
trying to
pissing me
get
off.
redemption, but
You're pissing me off.
now I'm pissed. So now we're even.
Favorite music though? What is your favorite music?
I'm more of a country girl.
Yeah, you give country vibes.
Do
Who's your
I?
favorite country artist?
Of all time, probably Shania Twain.
Shania Twain?
Mm-hmm.
Did you
That's
go
a
watch
good
her?
one. That's a good one.
Did I what?
Did you go watch her since she's been
Oh yeah.
touring again? Really?
Yeah, I've been twice.
I feel like she wasted her
God.
Her good
youth.
years.
Yes. You know
She
this, right?
disappeared.
Well, she had all those songs, right?
Yeah.
The One I Love and
Well, she married her music producer, right?
yeah, but like she was like she came out with like that don't impress me that much, and like she was like fuck off basically. Don't like I'm not interested. And then now she's coming back like 30 years later or whatever, 20 years later, she's like wants that same feel, but it's like the time has passed.
Well, the music that she's coming out with now feels very different than before. And so I think when people are going to her shows, they're still wanting to hear the Any Man of Mine and, whose bed have your boots been under type vibe. And then she'll try to sprinkle in some new songs and everybody's like,
She's trying to do like a Taylor Swift thing.
Don't get started with that.
I was like, what?
You don't think so? I feel like she's giving me some poppy vibes.
Maybe.
She's always been kind of, she's country, but kind of not.
She was like the Taylor Swift before Taylor Swift.
Yeah, she was I think she was in her own genre for a little bit.
She's the one that kind of started the poppy. Her, like Garth Brooks started going a little poppy. Like
Garth Brooks poppy?
Yeah. Like Garth Brooks wasn't Trace Adkins. He wasn't Tim McGraw.
I don't know, dude.
I don't
You know
know
what I mean?
either.
He's
like
on the same level as George Strait.
No, I love Garth
Yeah.
Brooks. I'm a Garth Brooks fanatic. I love Garth Brooks.
Okay.
But he's not. He was more rock. Like he had the I don't even know what kind of guitars it was, but he had different types of guitars, different instruments.
All right.
Still very country, but it wasn't Alan Jackson country.
Well, that's
You know what I mean?
Yeah.
Like it started transitioning with Garth Brooks
Okay.
a little bit, I think.
Interesting. So what's your music choice?
I really don't. We were just talking about this. I really
90s rap.
I really don't listen to. I listen to podcasts.
Oh.
But if I am with my family, then it's mostly like 90s, 2000 music. That's when I stopped listening to music.
Super.
I'm sure they love that.
Yeah, we were like listening to Bedrock. Like I can hear that.
I don't listen to Bedrock.
It's like just the worst music.
I really don't listen to music a whole lot. I listen to.
I don't listen to Bedrock.
Yeah.
I like Bedrock, but I just don't listen to it. Audio, like when I'm working out, it's podcast or audiobooks.
Okay. Good for you.
Yeah.
What about you?
I'm country.
Okay. Sounded like a question mark on
we
the
like
end
dancing.
there.
No. I mean, I went to the rodeo a few times already.
Nice.
We went and saw Nickelback.
Oh, wow.
So we're committee members.
Yeah.
And so we can go to all of them that we want to. But Nickelback, for as much shit as they get for being who they are, no, it was packed. We couldn't even get a seat anywhere.
Wow.
And so I really enjoyed that he leaned into all the comedy of the internet. And so he goes, "Ladies and gentlemen, does anybody like look at my graph?" And they're like, he goes, "Yeah, I have the internet." You remember? So look at this photograph, and he holds the frame and it has a graph, and it says, "Look at this graph."
There's a bunch of them though.
There's a giraffe, whatever.
Yeah.
So he leaned into it.
That's awesome.
He seemed really.
I like Nickelback, man.
He seemed pretty witty. They have so many good songs that I just forgot about. Like you probably don't know they sing Animals. Like we're just acting like we're animals. Move.
I don't remember that one.
There's nothing wrong with this.
You don't have to keep singing. I don't remember. I don't remember.
We need to play this on the little Bluetooth.
Yeah. We can do that.
But so he came. He's real witty. So like when he started, he goes, "Hey everybody, we've never been to the rodeo, but this isn't our first rodeo."
Wow.
It's like right out the gate. I was like, all right, dude.
Yeah.
But he cut all his hair, so it's like not like the traditional Nickelback.
Right. Yeah. He started a trend.
Oh, I'm not connected.
Oh, well.
Here we go.
Oh, well.
It's all good.
But they're very rock. But so anyways, we did that. We did my girlfriend did Jelly Roll.
Oh,
which
good
was
for
really
her.
good.
I love Jelly Roll.
She brought out Cody Johnson. I was so mad I wasn't there.
So you like Cody Johnson?
Mm-hmm.
We like all the music he's been coming out with.
Yeah.
Until You Can't. Like she's like balls every time he sings that one.
Which one?
Until You Can't.
Oh yeah.
Yeah. But yeah, we met out at like Big Texas over there in Clear Lake. Okay. And so we're really in the country, but I like a lot of sad music too, though, outside of country. So I like to just act like my life's just terrible.
Falling apart. Me too. Here for it.
Yeah. So yeah, a lot of folky stuff that's coming out too.
Like
what was that one we were just listening to?
Oh yeah. TikTok kind of doing a lot of stuff with that too. But there's this guy named
his name
Noah
is Jon.
Kahan. No.
Oh, that's close.
Who?
Noah Kahan.
Yeah.
Yep.
Noah Kahan. So I have a bunch of his. One of our friends kind of hooked me on that.
Yeah, he's got a crazy voice though. It's a good one.
And Zach Bryan, like all those that we're like creating a new like genre almost. It's country, but it's like
with the kick.
It's like folky a little bit. Yeah, but Noah Kahan's a real big one. Chance Pena. There's just a bunch of people kind of like that, but I like someone that can kind of cry and have like a big range and maybe hit a high note in there.
There you go.
It's gonna be a meme soon because all these, we know why they're popular. The moments in the songs and the way they twist and turn, it's almost like mimicable to where it's people are gonna be like make a spoof song about like, because there's ingredients to making this type of like these types of songs, and it's like normally like a build up, and then there's like an emotional note that's a little off key, but it sounds good still.
Yeah,
kind of like the Zach Bryan kind of does.
Well, it's almost like the country. There's that comedian that made the country joke.
Yeah,
he sang the country. I forget the name of the comedian, but he was making fun of country songs today because it's just a bunch of like rhyming words like dirt on my truck, cold beer in my hand, and he sings a whole song.
Christ,
is that the name of it?
Yeah.
He's
hilarious.
He's so funny.
Yes.
Do you like Tomlinson? The girl, she's on Netflix. I can't think of her first name. But you're
blonde?
Yeah, your comedy, the way you tell jokes is kind of like her.
Really?
Yeah, I'm trying to think of her first name.
Is it Leah? Tomlinson? No. Okay.
Scratch that.
Yeah.
Pop that.
I wish. Oh yeah, there it is. It is Taylor Tomlinson.
Taylor. Okay.
Let me see.
Yeah,
Everybody I
she's
show
about to
her,
be-
they don't like, but I really enjoy her comedy. But the way you structure your sentences or whatever, it's like very comedic.
Similar.
But it's kind of similar. Like the little things you say after a sentence, you know, like or like.
Yeah.
So she does a lot of that.
I had a guy point out that I work with that I would make a comment like, well, what do I know? A lot. And he's like, you know a lot.
That's a very funny thing to say.
Yeah. I was like, all right, I'll work on that. Because until somebody points it out to you, you don't really notice like your isms, you know? And so he was like, you say that a lot. And I was like, that's true.
So, yeah. Like my wife says, so.
I've seen that.
When she talks. Like to feel, I guess she's not comfortable with not talking after the end of the sentence or something. So
you say comfortable like I say comfortable.
Comfortable? I usually say comfortable.
I don't have a T in mine.
I say comfortable. Okay. Well, I know you're close on time.
Yeah, I got to get going.
Okay. Well, we appreciate it. It was very fun.
How can
people follow you on social media and get in touch with you?
You can find me at alpha.chiro on Instagram and TikTok.
Perfect. Well, thank you. We had a blast. We'll tag you up whenever this comes out.
Please do.
Actually, next week, actually.
Okay.
So, all right.
Do I get to do a proofing first before?
Do you want to?
Maybe.
I'll send you like a private link.
Okay, great.
And you can watch it.
Yeah, because if I'm like, take that out.
Okay. Please don't say that.
Don't say that.
Please don't say that.
The AI doesn't like that.
Yeah, AI don't like that.
It's not so easy.
It is not very AI.
AI friendly.
I'll send it to you though.
Okay.
We have had a lot of people want to proof it. We just had a sheriff. No, really a lot. We've had a lot of guests want to like approve it, and they're like, "Oh, I'm gonna have to take out a bunch," and then they watch it and they're like, "Oh my god, it turned out really good. I don't need to take out."
The bar's here then, so we'll see.
We'll see.
Yeah, thanks for saying it like that.
Yeah.
But anyway, thank you. We enjoyed it.
I enjoyed it.
Bye,
Thanks
bye,
for
bye.
having me.
Bye. Did you catch it?
I did.